of New Jersey. Page 879.
Without objection,
line 7.
the amendment will be considered as read, and the gentleman from New Jersey is recognized to explain his amendment.
Mr. Chairman, I'd like, well, let me say, this omnibus amendment is in essence what we discussed last Friday in this committee, but we do have certain changes, and I'd like to discuss those changes. First of all, the omnibus amendment no longer includes the Class Act, a bill that I introduced with Chairman Emeritus Dingell. We will be discussing the Class Acts separately. I also no longer included the Wise Woman extension, a program we discussed also last Friday, and which Ms. Capps will be offering as a standalone amendment as well. And as discussed on Friday, the menu labeling provisions will also be discussed separately from the omnibus, and Mr. Matheson will be introducing that amendment. And finally, we have included a few minor but important technical correction amendments spearheaded by Ms. Matsui, Ms. Christensen, and Ms. Sutton, which have all been reviewed and cleared by the Republicans. As I said on Friday, this amendment is the product of a lot of hard work on behalf of many members of this committee. I thank you for all your efforts, and I support this amendment and urge my colleagues to do the same. Mr. Chairman, I would ask unanimous consent at this time to strike from my amendment language on page 2 relating to the Sutton amendment that was actually adopted earlier this evening. So I would ask unanimous consent to strike the Sutton amendment, which we've already adopted.
Reserving the right to object.
Gentlemen, was there unanimous consent request?
It was a UC request to strike from my amendment language on page 2 relating to the Sutton amendment that was already adopted.
okay.
This evening.
I'm just reserving the right. I'm not going to object. I'm just
Yes,
reserving the
gentleman's
right
recognized in his
because I
resolution.
want to make sure that we all agree on what is in the amendment. My understanding, in addition to things that you've said have been taken out of the amendment, the menu labeling, the Class Act, the things that are still in it that are supported on both sides of the aisle, the expanding volunteer liability protection to volunteers at community health centers, that's still in it, is that correct?
Yes.
The providing grants for nurses in managed health centers is still in it, is that
Yes.
correct? The allowing behavioral health centers to receive grants for providing mental health services, that's in it.
Yes.
The reauthorization of the telehealth program is in it.
Yes.
The reauthorization of the trauma care center program is in it.
Correct.
The codifying of the Emergency Care Coordination Center at ASPER is in it.
Correct.
The classifying of dental providers as emergency responders is in it.
Yes.
The providing research for pain care and management is in it.
Yes.
The encouragement of activities towards postpartum depression that Mr. Rush has been so strong for, that's in it.
Correct.
And the section that allows for influenza immunization at schools is in it.
Yes.
Plus some changes to a Matsui amendment on a requirement to establish a national strategy through evidence-based clinical and community prevention and wellness activities. That's in it.
Yes.
I believe that's it.
That's it, and we just
That's all?
did the UC on the Sutton amendment.
Yeah. So with that understanding, I will remove my objection. Well, I will not object. I do support the unanimous consent request.
Gentleman
Mr.
New
gentleman
Jersey.
from New Jersey yield to me.
Yes, Mr. Dingell.
I have a unanimous consent request this time. It's an amendment regarding school-based clinics. This is, this unanimous consent request is offered pursuant to discussions between myself and Mr. Hall. I'm informed that Mr. Hall is in full approval of this. And the amendment would add to the amendment offered by the gentleman from New Jersey the following language. Page 1003, after line 17, insert the following new paragraph. 4, no funds may be used to provide abortions. Page 1008, after line 6, insert the following new subparagraph. E does not provide abortion services. and make appropriate conforming punctuation and formatting changes. I'm glad to yield to my friend.
Reserving the right to object, and again, I
Of course.
will not object, but this unanimous consent request is the result of a collaboration or cooperation between yourself and others on the majority side and Congressman Hall on an amendment that he was prepared to offer. Is that correct?
That's correct, yes.
And Congressman Hall, who's not in the room, is supportive of this. Is that correct?
I am informed that Mr. Hall is supportive of this. He and I had a discussion on the floor, and we agreed to this at this time. The final language is just now available to me and to the committee.
With that understanding, we will not object. We support the unanimous consent request of Congressman Dingell.
We've heard the unanimous consent request from the gentleman from Michigan, Mr. Dingle. Is there any objection? Hearing none, that will be the order.
Mr. Chairman,
Mr. Pallone,
Will the gentleman from New Jersey yield?
well, just before we do that, Mr. Pallone, you had a unanimous consent request.
I had, the
Four.
first thing was the UC to strike from my amendment, the Sutton Amendment, which was already
Okay.
adopted.
Is there any objection to that unanimous consent request?
We don't object, Mr. Chairman.
If there's no objection, that will be the order.
And then we have Mr. Matheson. Oh, I'm sorry. Mr. Matheson had a UC also, Mr. Chairman.
Mr. Matheson?
Thank you. I ask unanimous consent that the Matheson-Upton food labeling amendment be put back into the en bloc amendment. We've had discussions with both sides of the aisle. I think we've resolved the concerns that were expressed on Friday, and so I ask unanimous consent it could be included in the en bloc amendment.
Is there any objection?
Reserving the right to object.
Gentleman from Texas.
Mr. Upton is not here. Before I agree to that, well, he just walked in. We'll ask Mr. Upton if he has an objection to. Okay. All right. Then I won't object to that.
We have unanimous consent pending by Mr. Matheson. Is there any objection to that unanimous consent request? If not, that will be the order. Anything else that people want to know? Who's seeking recognition? Yes, Mr. Pitts.
Yeah, Mr. Chairman, I just want to confirm with Mr. Pallone that they did insert into the amendment the UC agreement on postpartum,
Yes, on the school-based
Section
clinic.
102, that has passed in previous Congress. Is that
It's in
correct?
there by a separate section called Sense of the Congress, Joe.
Okay. All right.
Well, I'm going to give it a try. I would like to ask unanimous consent that the whole bill be considered as part of the Pallone Amendment.
I do object to that, Mr. Chairman.
I thought we were on a roll.
Roll there, yeah. Well, don't get too antsy.
So we have before us the Pallone Amendment as it further was expanded by some unanimous consent requests. Further discussion of that amendment? If not, let's proceed to the vote. All those in favor of the Pallone Amendment and all the other amendments attached thereto by unanimous consent, say aye. Aye. Opposed, no. The ayes have it, and the amendment in the nature, the amendment in block is adopted. Now to the Republican side, Mr. Borton.
Mr. Chairman, I have an amendment at the desk. I believe it's it's the Barton Transparency Amendment, number Trans 001.
Clerk will report the amendment.
007, I'm sorry.
Reserving the right to object.
It's an amendment. It's not a UC,
I'll withdraw that reservation.
it's not a UC request. It's just an amendment.
Amendment to the amendment in the nature of a substitute to H.R. 3200 offered by Mr. Barton.
Without objection, the amendment will be considered as read, and the gentleman from Texas is recognized for 5 minutes.
Mr. Chairman, this is a straightforward amendment dealing with transparency, which, to my knowledge, everybody on both sides of the aisle on this committee supports. It would create an independent entity within the Health and Human Services to collect and to publicly disclose pricing and risk-adjusted quality data so that consumers and providers would all know what the facts really are, and would enable those that use services to make a better decision on which provider or which facility to use. It's straightforward. It's not a gotcha amendment. Regardless of which side of the aisle members sit on in terms of this committee, we all know that we need to reform the existing health care system. There are differences, obviously, about how to do that, but I don't believe anybody should oppose an amendment that simply makes it possible for the HHS to collect and to publicly disclose such information.
Gentlemen, yield to me.
Be happy to yield.
I know our staffs have been talking about this issue, and I support the idea of more transparency in healthcare pricing and quality, and I also agree we ought to get appropriate information to consumers. But I think that there are some issues that were still under discussion, and I wonder if you would be willing to withhold this amendment so those discussions can be completed.
I would be happy to withdraw it with the chairman's understanding that we really will have discussions and try to dispose of the amendment sometime during this markup.
Absolutely. You have my assurance on that.
Then I would withdraw the amendment at this time.
Thank you very
Mr.
much.
Chairman.
Who seeks recognition? Gentleman from Texas.
Mr. Chairman, if I could just ask to speak out of order. I have an amendment on transparency. We worked with Congressman Burgess and Congressman Stupak and Congresswoman Sutton that I think will do the transparency. And if Joe, if we get a chance, we'd like to talk with you about it because we.
I've got no pride of authorship. I'm interested
Great.
in the subject, and if there's a transparency amendment that the majority is working on, if we can dovetail, I'm more than willing to be a part of that process.
Okay. We'll get our staffs together. Thank you, Mr. Chairman.
Thank you, Mr. Green. Further amendments? Ms. Capps. You have an amendment at the desk.
Mr. Chairman, I have an amendment at the desk, and it's marked CAPS 001.
Clerk will report the amendment.
Amendment offered by Mrs. Capps. At the end of Title V of Division C, add the following subtitle: Extension of Wise Woman Program. Section blank. Extension of Wise Woman Program. Section 1509 of the Public Health Service Act, 42 U.S.C. 300N through 4A is amended 1. In subsection A, by striking the heading and inserting, quote, in general, and B,
Without objection, the amendment will be considered as read. Gentlelady from California is recognized for 5 minutes.
Thank you, Mr. Chairman. This language of this amendment would increase the authorization.
Gentleman from Louisiana reserves a point of order.
Thank you again. This language would increase the authorization level for CDC's Wise Woman program, which provides basically 3 things: cardiovascular disease risk factor screenings, second, healthy lifestyle programs, third, healthcare referral services. And it would provide this program to uninsured and underinsured women ages 40 to 64 years. The CDC currently funds 21 programs in 19 states and 2 tribal organizations, but the success of the program warrants its availability to women throughout the United States. It has been proven to save women's lives at a cost of $4,400 per estimated year of life saved, as opposed to a much higher bypass surgery expense of $26,000 per estimated year of life saved. And just this past week, Secretary Sebelius highlighted the program as a health care success story. She released a report pointing to Nebraska's program, which has screened over 19,000 underserved women since its inception in the year 2000, and during this time has significantly reduced the incidence of chronic disease and early death. As we work to improve our nation's efforts in prevention and wellness, we don't need to reinvent the wheel. we can build off programs that are known to be and that are proven effective. So I urge my colleagues to support this proposal for increasing authorizations levels for wise women so that we can replicate a very successful program in more parts of the country. And I yield back,
Gentlelady,
or I yield to someone.
gentlelady yields back her
I
time.
yield back.
Mr. Barton.
Mr. Chairman, I rise in reluctant opposition to this amendment. We are not opposed to the extension of the Wise Woman program. Problem with this particular amendment is in the authorization section beginning down at line 16. My understanding is the current programs are authorized and are expending in the neighborhood of under $20 million a year, and I would ask the council if they could confirm that. Do you know what these programs are spending right now?
I am told that the appropriation for fiscal 2009 was just about $20 million.
20 million, that's three
Million
zeros
with
different
M,
than
I'm
20
sorry.
billion. Okay. So
But I apologize.
that's my understanding
The
also.
labor agency appropriation passed on Friday out of committee for 2010, and I do not know that number.
Okay, well, I'll ask the author of the amendment, or authoress of the amendment, do you know what the latest HHS appropriation that just passed is for these programs?
I don't know exactly what the current one is. I think since it just passed last week, we should be able to find out for you, sir. But the CDC says that increasing the funding to $85 million, as this amendment would do, would allow the Wise Woman program to increase the number of women screened by an additional 25%. And that would provide screening services to all eligible, well, and that would allow all eligible women, it would cost about $200 million total.
Well, reclaiming my time again, we're not opposed to this program. We're not opposed to the reauthorization of this program. Our problem is a fiscal conservative. If we're spending about $20 million a year, an authorization level, if you want to double it to $40 million, that would seem to me to be a sufficient 100% increase in 1 year of authorization would seem to be rather substantial, but quadrupling it does seem to be a little bit much. And so for that, you know, our problem is with the amount of the authorization, not with the underlying program itself. So at least I oppose it based on that grounds.
Further discussion? Are we ready to proceed to a vote?
Well, could I, Mr. Chairman, or on his time, if I could just say once again,
I'd be happy to yield.
there is an estimated cost savings for every woman's life who comes under the program, and that you know, the cost of a bypass surgery at $26,000 a piece as opposed to $4,000 extension of their lives. The cost per participant is about $400. So however much we extend it, we're going to be adding benefit far beyond the cost of the legislation. I'm not sticking to the absolute number. The more women who are exposed to this program, who get the benefit from it, it's something that has been demonstrated to be cost effective. I believe it is something that is well worth our consideration.
Well, before I yield back, would the gentlelady accept a unanimous consent request to change the authorization level to $40 million and then increase it each year by $5 million a year?
Forever?
Well,
Just kidding.
through the year 2014.
I'm just kidding. You know, whatever seems feasible. The ability to add a significant amount would, in my opinion, be worth it, the time that it's taking us to consider the legislation.
Well, I mean, you'd double the authorization and then increase it for $5 million each year for the next 4 or 5 years.
It's talking about the number of women we want to reach.
Okay.
And the value of their lives.
So you would object if I made that unanimous consent request?
I would object.
Okay.
Let's
I yield back, Mr. Chairman.
Let's proceed to a vote. All those in favor of the Capps amendment say aye.
Aye.
Opposed, no. No. The ayes have it, and the amendment's agreed to. Further amendments to the pending amendment in the nature of a substitute.
Mr. Chairman.
Mr. Deal.
Mr. Chairman, I have an amendment, the Ryan White Care Act. I think it's number 151.
Mr. Chairman, I reserve a point of order.
We could extrapolate how much. It's only $20 million.
It's
Yeah,
Deal
Mr.
002.
Scalise, you had reserved a point of order on the last one, but you withdrew it, right?
On our team.
I assumed if a point of order is not asserted before the vote, the chair will assume that the point of order is withdrawn.
It's 002.
Okay. They're just logging in right now.
Amendment offered by Mr. Deal of Georgia. At the end of Title V of Division C.
Without objection, the amendment is considered as read, and the gentleman from Georgia is recognized for 5 minutes.
I thank the chairman. This amendment would reauthorize the Ryan White Act, the Ryan White program that is going to expire at the end of this September. I think most of the members of this committee are very well aware of the vital services that this funding program provides. I know that there may be a concern that this would be something that would be handled separately at a later time. I quite honestly, in light of the time constraints that we're facing, wondered why it was not included in the en bloc package that we considered earlier. I think it is of the same general nature, a program that has been in place for a number of years, one that almost all members of this committee agree with. I'm concerned that if we wait until a later time, that we will run into a situation where this committee does not exercise its jurisdiction to reauthorize this program, and we will see the Appropriations Committee usurp the jurisdiction over this issue from us and deal with it as an appropriations matter rather than appropriately as a substantive legislative matter within the jurisdiction of this committee. I think the amendment is very forthright. I think it addresses the concerns that many have had in the past, and I would urge its adoption.
Gentlemen, yield to me.
I will.
Thank you very much. I appreciate your interest in seeking to extend the Ryan White HIV/AIDS program for the next 3 years, and I'm also committed to addressing this issue. But we've heard from the HIV/AIDS community, and they've given us a proposal for extending the program. We have not had a hearing on their ideas, and I think they deserve to be heard. I'm not sure that I agree with all the proposed changes that have been recommended to us. This is a major reauthorization. For example, the amendment does not continue the protection for states with maturing HIV case data, which would greatly impact such states as Georgia and California. The CDC has stated that this data will not be mature until 2012. Thus, those states that transition to name-based HIV surveillance are currently undercounting their HIV data, which skews operation of the HIV-based Part A and B formulas. Before we act, I think we need to fully understand what changes we should make to the program as we extend it. So I appreciate your interest in the matter, but I would not be willing to support this amendment at this time. We will take up the HIV AIDS Ryan White program and have some further hearings on it. I don't think we have to act now. It doesn't have to be within this bill, and I think it's involves a lot of issues that we need to look at a little bit more closely.
Well, reclaiming my time.
Yes.
I understand that the gentleman's concerns about the way that we calculate the distribution of revenue. And that is one of the things that has been before this committee in the past, and we have grandfathered in states such as California, where I believe you still continue to use the number count rather than a name identification. And in previous hearings before this committee, it has been shown that parts of the country, the West, the Midwest, and the South, are generally coming up short on revenue because other parts of the country are using a numbers system counting people who are already deceased. And the purpose of grandfathering these states that are using that system in, and I believe it was a 3-year grandfathering period, was to allow them to make that transition. The longer we postpone that, the more we continue a discrepancy that exists in the law in terms of accurately distributing the revenue all across the country. This amendment would deal with that issue. It would not allow states to use the names of people who are no longer receiving services but continue to get funding as if they were still receiving those services. And understand the chairman's concerns, but I think it's time for us to address that issue. I would yield back.
Would the gentleman yield?
Gentlemen, yield to me?
Yes, I will.
Well, you raise a good point of why we need to deal with this legislation. It is expiring in September of this year. We will do a reauthorization, but I think we ought to, in my view, do it in a more thoughtful way, rather than just simply extending the law for the next 3 years. And you've raised some good issues that we need to look at carefully.
I yield back.
Mr. Chairman, I'll withdraw my reservation.
Mr. Chairman,
Who seeks recognition?
over here, Mr. Chairman.
Yes. Gentleman from Illinois.
Thank you, Mr. Chairman. I just find it very difficult to make the case that we have legislative language here and we're unwilling to move on a timely manner on health care because we haven't had a hearing. You've got to be kidding, Mr. Chairman. We passed a cap and trade bill with billions of dollars of allocation, agreeing to have a hearing after the fact on how the allocations would be, used in the bill that we passed in law. And now we're saying that Mr. Deal has a pressing concern that needs to be reauthorized, and because we haven't had a hearing on this bill, when we had a hearing on a draft bill, a tri-committee bill. Our hearing was on the draft bill. Then we had a dropped bill, and then we had the CBO score the tri-committee bill, and we had a closed hearing on the CBO scoring, and then we had a manager's amendment of 300 pages, and you're going to make the argument that in this case we have to go through regular order? I'm just astounded, and I'm sorry that that's your line of logic in disagreeing with my colleague's amendment, and I hope calls for a vote, and I will support it.
Would the gentleman yield?
I would yield.
So I don't have to get my own time. I want to support the Deal amendment, and for one primary reason. First of all, the Ryan White Reform Act that we passed several years ago was done on a bipartisan basis. There were several compromises that were carefully worked out in the stakeholder community and across lines, both here in the House and the other body. I was very proud that that passed under my chairmanship. I take Chairman Waxman at his word that he wants to reauthorize the Ryan White Act sometime this year, but the problem is that it expires in September. We're in the middle of July. We're going to be out of here in the next 2 weeks. There is no time to have a hearing, to have a markup on a standalone bill. And when we get back in September, we're going to be involved in the appropriation process. And if, and I say if, the climate change bill goes to conference with the Senate, and if we get this health care bill out of the House and the Senate does, and we go to, with all due respect, Mr. Chairman, even with the best of intentions, it's very unlikely you're going to have time to give the HIV/AIDS community the standalone time that it needs. I would suggest that we should pass this reauthorization amendment into this act, do all the due diligence that you've talked about. We can work out whatever compromises need to be worked out and include them in some sort of a bipartisan manager's agreement if and when the health care bill goes to the floor or in conference with the Senate. But at least according to the Speaker of the House and the President of the United States, this major health care initiative is a must-pass, must-do piece of legislation, and that means we should put things like this in it. And in this case, I don't think that this is really that controversial. There may be some community concerns about revenue sharing and amongst cities with growing AIDS, HIV populations and communities that have historically had high concentrations but are declining. So there may be some of that need to be worked out. But the basic reauthorization should be pretty straightforward. I don't know why we can't accept this. So I hope that we do accept it. And I yield back to...
Reclaiming my time, I want to talk process again. We accepted cash for clunkers in the energy bill without a single hearing, a major policy provision. And then that bill was pulled out of the passed bill and thrown on the floor without any hearing or committee process. So y'all can do pretty much what you please. And I would suggest that this bill and this reauthorization, we ought to include this. And I, again, will support my colleague's amendment.
Mr. Chairman. Gentleman's time has expired. The chair recognizes himself. I was the original author of the Ryan White Act in 1980s, 1990s. No, it was 1990. It was passed on a bipartisan vote. In every reauthorization in this committee, it was passed on a bipartisan vote. And I don't think we ought to have the Republicans trying to use this now for a partisan issue to say we got to do this now.
Mr. Chairman, I object to that. We're not being partisan about this at all.
Well, then let me...
You're the one who's scheduling the markup. You're the chairman.
Well, let me reclaim my time by saying we've got some issues to deal with in this bill. And if we simply adopt this legislation in this broader bill and reauthorize the Ryan White Act, we will not have addressed some of the concerns that many members have, including the Speaker of the House, who's communicated to me her concern about reauthorizing it without changes. We need to revisit some of the terms of this legislation. Now, I think it's appropriate to do that in the context of hearing from those who have concerns about it, not simply extending the reauthorization for an additional 3 years. I know that the gentleman from Illinois wants to pound the table on the process. I used to have a good friend said if you have the facts, you pound the facts. If you have the law, you pound the law. And if you don't have either, you just pound the table.
Would the gentleman yield?
No, but the facts of the matter are that while I will acknowledge that some of the complaints that people have are legitimate, we had hearings on the health care bill. The tri-committees...
Gentleman yield.
Oh, please. We had hearings on the draft proposal. We had extensive hearings on the energy bill. We even had hearings on the last part of the energy bill with allocations, although it was after the fact. We could hold hearing after hearing. And that's more than what we had on many of the items that we had before us when the Republicans were in control. Anybody want to say no real loud?
Would the gentleman yield?
I will in a minute.
I'll be happy to comment on that.
I probably shouldn't even go down that road because you're going to go down that road. We're going to go down that road. You did it. We did it. This amendment is to reauthorize the Ryan White Act. It's a major reauthorization. We should do it this year in this committee, working together. In terms of the expiration, it's the expiration of the authorization. The Appropriations Committee often moves forward with appropriations, notwithstanding reauthorization not having been passed. We will be able to get to that reauthorization as soon as possible, certainly within this year. So I would urge members to not rush this thing through without getting full impact from the different stakeholders and not just keep the status quo.
Would the
Mr.
chairman
Engel, yield to you?
Yes, thank you, Mr. Chairman. New York still remains the epicenter of HIV/AIDS. So the Ryan White Act is very important to me. It's been one of the things that I have been working on for many, many years. And, Mr. Chairman, I want to share your concerns with just reauthorizing the program such as this. I speak with the HIV/AIDS community all the time. They have many different proposals for changing the program and extending the program. And I think that we ought to listen to them, and I think it deserves to be passed, as you said, Mr. Chairman, in a bipartisan fashion with give and take, and having the HIV/AIDS community a very, very important part of the process. And I think that if we simply just reauthorize it in this bill, we will have made a mistake, because we'll have lost a lot of the input of the people who this affects the most. So I agree with you, Mr. Chairman. I think that we should not do this now. We have a very limited time, obviously, because it has to be reauthorized within the next few months, but we should make sure we give it the attention it deserves as its own stand-up bill, as you said, with the give and take of bipartisanship. We did it with Chairman Barton before, and we tried to do it in a bipartisan manner, and I'm sure we will do this reauthorization in a standalone bill in a bipartisan manner as well. As you point out, there are many concerns that many of us have, the Speaker and you and I and others. We would like to see some changes into the reauthorization, and to simply extend it now would be to run roughshod over those changes, and I think it would be inappropriate. So I yield back, but I think
Thank
you're
you,
you're
Mr.
right on the
Engel.
money with this.
And I yield back the balance of my time. Further recognition, Mr. Barton.
I haven't spoken on my own time, Mr. Chairman, so I'm going to speak in favor of the amendment. And I want to educate the more junior members of the committees on some of the things that Chairman Waxman just said. It is true this year that he and the subcommittee chairman on the majority side have held a number of hearings on these big issues. They held hearings on the general issue. Now, there used to be a tradition in this committee that you would put out drafts, you would circulate the drafts, you would modify the drafts, and finally, when you thought you had consensus amongst what should be in the bill, or the majority decided that a consensus was not possible, then you would circulate the bill that was actually going to be marked up, and then you would hold a hearing or legislative hearings at subcommittee and sometimes at full committee on what you intended to mark up. A legislative hearing. Now, we had one so-called day of legislative hearings on this bill where the Secretary of HHS came forward and testified that she really hadn't seen the bill because the bill hadn't really been put together. And then we had a closed briefing, not a hearing, where CBO came forward and commented without the public or out the press that they really hadn't been able to score the bill. They were scoring a verbal explanation of the majority staff's explanation of what was in the bill. That is not regular process. That is not a legislative hearing. That is, in my opinion, a diminution of the process. Now, the reason the Ryan White Reauthorization Act is expiring in September is because when I was chairman and we reauthorized it, we wanted it to come up in a timely fashion, not 5 or 10 years down the road, because at least then, and I'm assuming that's still the reason that there's stakeholder concern, you have communities in the country where the AIDS, HIV population is growing, and then you have communities where historically they've had concentrations, but those areas are either declining in the intensity of the epidemic, or they're not as relevant, and there is a formula where you take total cases into consideration, but also existing patients who have the condition, and that's an ongoing debate. Now, had the majority been totally sincere about reauthorizing this, they would have been holding hearings at the subcommittee level and perhaps at the full committee level to bring the stakeholder community. There's not been one hearing on the Ryan White Reauthorization Act scheduled, Mr. Pallone's subcommittee or the full committee. There hasn't been a general hearing. It hadn't even been noticed. Now, we have an arbitrary timetable by the Speaker of the House and the President that this health care bill has got to move out of the House before the August recess. That's not a a bill that's expiring, like the Ryan White's Act. That's not a statute in law. That's some sort of a internal policy decision between the president and the majority in the House that this bill has to, the bigger bill has to move. Why wouldn't we put this on it? Chairman Waxman's not going to schedule a hearing on the Ryan White Act next week. He's not going to have Subcommittee Chairman Pallone move an authorization bill through subcommittee next week. Why do we not put this in the bill that's got to move? And then, as we go through the process, if the process goes forward, then we can make some of these changes that Congressman Engel and Chairman Waxman are talking about. I mean, this isn't partisan. This is the train that you guys say is leaving the station. Let's put the stuff in it that we have bipartisan support. Let's do it. Now, I don't, call me crazy, but I don't see why that becomes a partisan issue. So I hope we put it in the bill, and then we do all the things. If Chairman Waxman wants to move a standalone bill next spring or later in the fall, we'll be very supportive of that. But this is the train, according to your own train master, that is leaving the station. So we ought to put this on the train. I yield back.
Mr. Chairman.
Gentleman yields back. Mr. Pallone. Gentleman's recognized for 5 minutes.
And I'd like to yield to you sometime.
Well, I thank you for yielding. I want to correct the record on a number of issues. We had a draft of this health care bill out, and then we had 4 weeks of hearing on the draft of the health care bill. Now, let's contrast that with the rosy picture that we've had that the Republicans never did anything out of the ordinary. They always followed regular order, had hearings, legislative hearings, oversight hearings, full opportunity for the process. Well, for the Medicare Prescription Drug and Modernization Act in 2003, in the 108th Congress, we considered that bill, which provided a new expensive prescription drug coverage under Medicare. Despite the sweeping policy and cost consequence of this measure, the committee held no public hearings on the legislation. There was no subcommittee markup. Democrats did not receive a copy of the legislation until late Friday afternoon before a Tuesday markup. In the 109th Congress, the committee considered H.R. 3893, which codified controversial Clean Air Act new source review regulations of the Bush administration and provided for the expenditure of hundreds of millions of dollars for programs relating to supply and use of petroleum and other energy products. The committee held no legislative hearings on the legislation, no subcommittee markup. Instead, the bill was released on a Friday night at 10 p.m., allowing only 2 business days for its evaluation before a full committee markup the following Wednesday. There was another bill that I took special umbrage to called the National Uniformity for Food Act of 2005. It was in the 109th Congress. Mr. Barton was chairman. The committee considered the bill, which would have preempted virtually every state and local law that protected consumers from contaminated food. It would overturn a long-standing law in California. The committee held no hearings on the legislation and no subcommittee markup. In the 109th Congress, the House considered H.R. 5254, a bill that directed the President to designate no less than 3 closed military installations as suitable for refinery construction and required states to meet a federal schedule for issuing refinery construction permits. This was put on the House suspension calendar, normally a procedure reserved for non-controversial bills. It was brought to the House floor just 1 day after it was introduced without the benefit of any legislative hearings or markup by the committee. The Energy Policy Act of 2002, Representative Barton introduced H.R. 3406. It made controversial changes to federal laws governing the electricity sector. This bill was never marked up or reported out of subcommittee or the full committee due to its lack of support among committee members, and the provisions were not included in the broad energy policy bill H.R. 4 that was considered by the House. Nevertheless, when H.R. 4 went to conference, then Committee Chairman Tozan and Representative Barton announced that the House would take H.R. 3406 into the conference as the House position. These are a few of the examples of how Republicans handle this regular order when they control this committee. Now, as I said earlier, I don't like that you did this, we did that, you did worse, we did better, worse, and we did better, and so on and so forth. I just think on this amendment that's before us, we ought not to put it in this bill. We ought to hear from the stakeholders. We ought to have a reauthorization. There's nothing that's going to happen in September other than the Appropriations Committee considering the appropriations and going forward, and we'll get a reauthorization in due time. But let's do it together on a bipartisan basis, and I would urge members to oppose the Deal amendment. I yield back the balance of my time.
Move to strike the last word.
Gentleman from Oregon is recognized.
Thank you, Mr. Chairman. I guess my frustration today, and I intend to support the gentleman's amendment, really gets back to this notion of did we have a hearing on this bill? And the state I came from, or come from, live in, when I was in the legislature, we had rules that required hearings before bills could be marked up. And I realize we don't operate that way here. Both parties have had, as we know, their problems. But on a bill of this significance, where we're going to have a complete government takeover of health care, a complete rewrite of everything else that's left, a public option, new taxes, everything else, you'd think we'd at least allow the people to come in who are affected by the extraordinary changes in this bill and have a chance to let us know how it affects them. I read in the New York Times that the governors, Republican and Democrat, gathered in Mississippi this weekend, and Republican and Democrat governors from Vermont to Mississippi raised very serious concerns, for example, about the Medicaid portions of this bill and the potential costs, unfunded federal liabilities that may go to the states. It would be nice to hear from the governors to get their ideas about how this bill operates. When Secretary Sebelius was here, I attended and participated in that hearing, but was told pretty clearly by the subcommittee chairman, as I began to ask Secretary Sebelius specific issues related to the bill text itself, that it wasn't appropriate to ask the Secretary of Health and Human Services specific questions about the bill because she wasn't necessarily here to testify on the specifics of the bill and didn't fully have it in her scope. And actually was told, don't be asking the Secretary questions about the draft. So I don't know who we were supposed to ask, if not the President's top person on health care, other than the czar, about the impact of this bill. So it just seemed peculiar to me to hear that we couldn't reauthorize the Ryan White program because we hadn't had a hearing on this amendment.
Gentleman, yield to me.
When, in effect, we've had no meaningful hearing from, I'm not on the subcommittee, but on the full committee. Yes, I
Gentlemen,
certainly.
well, you're not on the subcommittee, but had you been on the subcommittee, they had over 50 witnesses testify before the Health Subcommittee on this very bill. The hearing that you attended was in the full committee because we had the secretary, cabinet secretary. But we had a week of hearings on the bill. The bill's been out for over 4 weeks.
Mr. Chairman, reclaiming, my understanding is that was the draft bill, not the bill we have before us.
It was the draft of this, it was the first draft of this bill.
The first draft, but it had not been introduced.
It had not been introduced as a bill, but it had been put out as a draft.
And that it changed after that to be the bill that's before us. In fact, 8 pages were added after the bill that came to us
I think
here.
that's about 500 pages ago.
What was the length of that draft bill?
It was around 700, 600 to 700.
Gentlemen, yield.
Yes.
It's not a question of the length. The draft bill set out the basic framework for this legislation.
Reclaiming my time, Mr. Chairman, if I might, it's about a 300-page difference or more between the draft. And I realize the draft represented principles, but I also know that there's a huge difference in one word, shall, may. There are huge differences in every word in every bill, or can be. All I'm saying is that it seemed a little peculiar to hear the argument that we couldn't reauthorize an existing program because it hadn't had a hearing. I actually favor hearings, But we could move forward on this bill that my own personal view is it hasn't had adequate hearing to really get into the weeds on what it does and how states will be affected.
Gentlemen, yield to me further.
There's a lot of concern in my state about Medicare and Medicare rates and what may happen to them if this bill becomes law, because Oregon is very efficient in its delivery of care and very low in its cost of that delivery. So any cuts across the board on Medicare have a significant and adverse effect in terms of access to care for Medicare recipients and whether providers can continue to go forward. There are lots of issues in here that affect us, and certainly, Mr. Chairman, my friend.
Thank you for yielding. I want to point out that the draft bill, for which the subcommittee held a week of hearings, was basically the bill before us. The biggest change in that bill that you've talked about that was changed was the part coming out of the Ways and Means Committee of the pay-fors. That is extensively spelled out. It's not the jurisdiction of this committee. I appreciate what you're saying. I think we ought to have, we're going to continue our oversight, our markup on this bill, and I just think on the Ryan White Act, we ought to hear from witnesses and proceed in a more orderly way.
Mr. Chairman. Mr. Chairman.
Who seeks, Ms. Schakowsky.
Yes, I move to strike the requisite number of words.
Generally, is recognized for 5 minutes.
On the issue of the Ryan White Care Act, I just want to say that I appreciate Mr. Deals and Mr. Barton's support for the act and their concern for reauthorizing it before it expires. I think that in general, the conversation about Ryan White is a good one, but I want to say that I've also heard from the AIDS Foundation of Chicago. I don't know if Mr. Shimkus is still here. Are you here? Okay, there you are. And while major changes in the act, they don't think are necessary, there are some adjustments that they think should be made. In fact, if they're not made, we stand to lose money in Illinois. And they, along with 250 AIDS organizations around the country, want us to look at the issue of the use of code-based data. And while they're committed to moving to HIV name-based surveillance data sets, they want to make sure that they're complete and accurate before formula funding awards are based solely on those data. And they also suggested a number of other things, expanding the coverage of food pursuant to a doctor's or dietitian's prescription as a core medical service, and reviewing the regulation that restricts access to medical transportation, particularly in large rural areas and areas without a strong public transportation infrastructure. So there's a number of ways that aren't huge but are significant that deserve that kind of discussion, and hopefully those of us, it seems like all of us or most of us who support Ryan White would support those kinds of changes. So I'm hoping that we can work together on a timetable that Mr. Waxman has committed to, that we're going to do it before September 30th for a reauthorization that's even better than the bill that we have now. So I would support not doing it in this bill right this minute, but to later on develop an even better Ryan White Care Act. And I yield back. I yield to my colleague from the Virgin Islands.
Thank you. I also want to say that I appreciate the ranking member and Mr. Deal's interest in reauthorizing Ryan White, and I look forward to working with them and you, Mr. Chairman, as we approach September to reauthorize it with the input of the AIDS community. I have a very good relationship with many of the AIDS advocacy groups, and they've asked us to include several issues that cannot be addressed if we rush to reauthorize it now, as well as the Department of Health and Human Services, and the administration also has some issues that they want to weigh in on. So I look forward to continuing to hear from these groups, to incorporate the issues that they feel are important, to looking at the distribution of the funding, because even when we reauthorized it for the 3 years, we did it for 3 years because we weren't able to address many of the issues that were really pressing, and so we did it for a shorter period of time. So I oppose the amendment and look forward to reauthorizing it with the input of all of the different groups in the administration.
Reclaiming my time, I'd like to yield to the gentleman from Texas, Mr. Green.
Mr. Chairman, members, and Mr. Deal, I remember the discussion we had when we reauthorized this a few years ago and when our ranking member was chair, and I know there will be discussion on formula battles between Georgia and Texas and California and New York, and I agree. I wish I could tell you I was prepared tonight to do that, because we did have a funding formula that at that time was fair. I don't know what I could support tonight, though, that'd be fair to the state of Texas any more than I could say it to my colleague next to me, the state of New York. So I have no problem putting off, because I want to have that battle when we get it in there. And I remember the battle we had was between California, New York, and other states that had a growing population of HIV that we could not get the recognition that we needed through Ryan White. And so I want to help you, but I don't know if tonight's the best night. And I thank my colleague from Illinois for allowing me a few seconds to say that.
Yield back the balance of my time.
Gentlelady yields back the balance of her time. Are we ready for the vote?
Mr. Chairman, I have a unanimous consent request.
Yes, Mr. Deal.
I would make a unanimous consent that instead of the 3 years shown on the face of the amendment, that it be a one-year reauthorization, since that way this committee would have acted to extend the legislation and will not be subject to the Appropriations Committee being the one who makes a decision about this very important piece of legislation. And I would ask unanimous consent to change the effective date for a one-year reauthorization.
Reserving the right to object. The reality is if the reauthorization is not in effect, the Appropriations Committee will still consider appropriations. So we don't have a drop-dead date on the reauthorization. And there are strong feelings about some changes that need to be made even for that one-year period. I'd like to talk to some of the groups involved. Have you talked to some of the groups? Evidently, our staff has talked to some of the groups, and they would just feel that they didn't get their chance for input, even on a one-year reauthorization. So, given that fact, I'm going to object to it, and suggest to the gentleman that maybe we can pull this off and discuss, because this is your subcommittee with Mr. Pallone, figuring out how to do a reauthorization in a timely enough fashion.
Mr. Chairman, I just don't see any time between now and the time that this act's going to expire to have the hearings and do what would normally be done to deal with a full-blown reauthorization. I assume that yours is an objection to the UC request.
Well, let me suggest this. How about withdrawing your amendment now with no prejudice to you coming back before we complete the markup on this legislation and see if we can figure out something to do together.
With the chairman's assurance that we can re-bring it, I'd be glad to withdraw and ask, and I will withdraw the amendment.
Okay, thank you. The amendment is withdrawn. We'll now call for further amendments that we can. Ms. Sutton.
Thank you, Mr. Chairman. I have an amendment at the desk. It's Sutton 17_001.
Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 3200, offered by Ms. Sutton of Ohio. And
Mr. Chairman,
Christensen
I
of
request
Virginia.
unanimous consent to waive the reading of the amendment.
Without objection, that will be the order. Gentleman from Louisiana reserves a point of order, and the gentlelady from Ohio is recognized for 5 minutes.
Mr. Chairman, can we have a copy of the amendment?
Yes. We'll hold off until member receives his copy.
Sorry.
Chair recognizes the gentlelady from Ohio.
Thank you, Mr. Chairman, and I'm honored to offer this amendment with the distinguished gentlelady from the Virgin Islands, Representative Christensen, who I will yield to in a moment. This amendment would authorize the Secretary of HHS to award grants to states, public health departments, free clinics, federally qualified health centers, and other nonprofits to promote positive health behaviors in medically underserved areas through the use of community health workers. Community health workers operate in association with local healthcare systems in both urban and rural environments and represent the first line of primary care in many parts of this country. They're utilized, as I said, by hospitals and public health departments and health centers, among others, and they operate in association with them. Various studies have demonstrated that community health workers can improve health outcomes while lowering costs, and many states have heeded that evidence, including the state of Ohio. However, existing community health worker programs struggle to find funding to cover basic operational costs, salaries, training, and many community-based organizations that would like to hire community health workers simply don't have the resources. So as I said, this would authorize the Secretary of HHS to award grants to states and public health departments and the like to help community health workers connect at-risk and potentially high-cost populations with existing services. The result will be improved chronic disease management, reduced use of emergency rooms, and fewer low-weight babies. Community health workers will play an integral part in a reformed healthcare delivery system that expands access and reduce costs. And if we're serious about expanding access and improving cost efficiency in the system, we should work with community-based organizations with existing or budding community health worker programs and help them have access to some of these resources. And with that, Mr. Chairman, I'd like to yield to my colleague, Representative Christensen, who is the co-sponsor of this amendment.
Thank you, Congresswoman Sutton, and thank you for your efforts and your leadership with this amendment to include the grant programs for community health workers in this bill. This provision is strongly supported by the Tri-Caucus. As a matter of fact, we've included it in our disparity elimination legislation in the last 3 Congresses and this one. And of course, as a physician who's practiced for more than 2 decades before coming to Congress, I do know firsthand about the incredibly instrumental role that community health workers can play. Not only are they on the front lines, especially in primary care, for so many men, women, and children in rural and low-income communities that suffer from provider shortages and inadequate health care, but many states have really shown that the community health workers actually improve health outcomes as they reduce costs. And therefore, this amendment offers a rare win-win, because it will create a way for community health workers to have the resources they need to promote healthy health behaviors and improve the health and wellness of Americans who live in areas that we know are not now well served by the current healthcare system. And they'll be doing this, providing counseling and guidance on health behaviors, advocating for individual community health needs, providing direct primary and preventive care. And as they do that, they'll be saving health dollars. And we're talking about individuals who are from the community, who share the same experiences, who have the needed level of empathy and appreciation, and who then have the trust of the members of their community as they provide these services. So I strongly support this amendment. I urge my colleagues on both sides of the aisle to support it, and to support the common sense measure of investing in those health programs that we know work, that we know will not only save money but also save lives. And I really feel strongly that this needs to be a key part of healthcare reform if all underserved communities, from the largest urban area to the most remote rural community, are to benefit from this historic legislation. And I yield back the balance of my time.
And I yield back, Mr. Chairman.
Gentlelady yields back the balance of her time. Further discussion?
Mr. Chairman.
Mr. Blunt.
Mr. Chairman, a question for council. I noticed both of my colleagues used the term community health workers. On page 5, paragraph D, it outlines that priority should be given to applicants who meet certain conditions, and then on page 6, line 2 through 3, it says that those applicants should have experience in community organizing. What does community organizing mean, and how is that different than community health workers?
I'm sorry, Mr. Blunt, I'm not able to. Could you give me those lines?
On page 6, line 2 and 3.
My page 6.
Oh, that was the original amendment language, I'm sorry. It's on page 5, it looks like number 3 on page 5. Have documented community activity and experience with community health workers.
Mr. Blunt, as far as I know, the term community health workers is not defined at the federal level. I know that some states do indeed have community health workers and may define them under state law.
But number 3, you wouldn't have to be a community health worker. You would have just had to have experience with them. Is that right?
Yes, sir.
So like ACORN, could that be a community organizing, community worker group?
I have to profess ignorance. It's community health worker is, to the best of my knowledge, not a defined term at this federal level. And
But we're not talking about, we're talking about somebody who has experience with community health workers and has been involved in community activity.
Would the gentleman yield?
I would.
Could I try?
I would yield, my friend.
Well, I think the intention here is that these grants will go to organizations or community health centers, but it can go to a not-for-profit organization, and we want to make sure that that organization has experience in training and utilizing community health workers if they're going to get these grant dollars, and that we want to also make sure that they are of the community, because we feel that those are the people who will engender the trust of the community and be able to be most effective in those communities.
So
Blunt,
if
Mr.
the
Blunt,
lady would, yes.
If I could correct myself, I'm sorry. I've been advised by Legislative
It is
Council
right
that if I'd only turn to page 8, that there is indeed a definition of community health worker here.
All right, so we'll know on page 8 who these people could have talked to, but we don't know who they would be.
So
Page 8 apparently says who the community health workers are, but it doesn't really say what it means to have had experience. But I take my friend's statement there that these would be people who were of the community and had experience with community health workers. That seems pretty undefined to me. This is $150 million, I guess $30 million a year for 5 years. If I calculate right, that's just the daily interest on the approximately $1.2 trillion this bill cost. So $150 million, I think, is one day's interest on $1.2 trillion. All right, that's, who wants time? Chair, I'll go to the chair.
Just briefly, I think what Congressman Blunt just pointed out, and the council was wise enough or honest enough to admit, there's not a real definition about the question of this nonprofit groups who have documented community activity experience with community health workers. Would the authors of the amendment be willing to withdraw it and let us work out some language on exactly what that is?
Mr. Chairman.
I yield the gentlelady from Ohio.
Thank you. Well, I think counsel misspoke when he first answered the question. Page 8 does define community health worker, and perhaps you all will find some assurance on page 6 when we talk about there are a lot of safeguards built into this amendment. The Secretary is required to establish guidelines for assuring the quality of the training and supervision of community health workers under the program and for assuring the cost effectiveness of such programs. There's also a requirement for the Secretary to monitor the program, as well as, of course, there's a report that will be done and reported back to Congress to see that, that this program works as required. And so I think that I feel comfortable with the legislation as it is, and I would hope that maybe with looking at those provisions, it would give you a level of assurance to proceed.
Well, our time has expired, but hopefully sometime in this debate we can get, I want to comment about this definition a little bit more, but the time's expired.
Time has expired. Further discussion of the amendment. Ms. Schakowsky.
Yes. I wanted to give an example. In the last couple of weeks, I met with Mount Sinai Hospital in Chicago, which is a hospital that serves a very low-income community. And they developed a program where they have community health workers that are going out and meeting with, going to people's homes that have asthma and teaching them how to manage their care, how to correctly use the inhalators, and about dust and about all kinds of things that are in the home. They told me that because of that program, they have reduced emergency room visits for asthma by 65%. And they gave me a dollar figure, which I can't remember, but a significant dollar figure, far beyond the cost of hiring these community health workers. And they were talking about the various other programs that they were going to initiate in order to reduce the cost for them of health care through the use of these community health workers. And the other point that they made is that, of course, by definition, these are people from the community who are now getting jobs. And, you know, they're not paying them a heck of a lot of money, but it's a really important way of employing people in the community and having incredibly successful health outcomes. So I really wanted to support this amendment. I'll yield to Mr. Sarbanes.
I just wanted to follow up. I appreciate Ms. Schakowsky yielding, but today, by coincidence, at 11:30, I visited a program in Baltimore called Baltimore City Healthy Start, which is a program that works with expectant mothers throughout the city. There were 9,000, I think, births in Baltimore City last year. This organization, which is a 501c3 nonprofit, served 1,000 of those women, and it did it primarily through the use of community health workers, which are defined for their purposes as people who came out of the community. And they testified to me that that made a big difference, because these are people who reside in the community, they have relationships in the community, they have the credibility that comes from being from that community. And it enhances their ability to reach out and provide these services. They're exactly the kind of group that would be a potential candidate to receive funding under this grant program. So I strongly, strongly support this amendment. I thank Ms. Sutton and Ms. Christensen for introducing it, and I yield back to Ms. Schakowsky if she so wants.
I yield back the balance of my time.
Gentlelady yields back her time. Mr. Scalise.
Oops, sorry. Thank you, Mr. Chairman. In addition to the language on page 5, which gives priority not to community health workers, but to applicants who have documented community activity and experience with community health workers. And I think when you go to page 1, it allows them to provide outreach in a community setting. And what's, I think, more concerning is on page 2, to provide experimental learning opportunities that target behavioral risk factors, including risky sexual behavior. Now, I'd ask counsel if you can explain to me what is or isn't
Will the gentleman yield?
to provide experimental learning opportunities to children with risky sexual behavior.
Will the gentleman yield?
I'd yield.
The word is, it's not experimental, it's experiential.
Experiential. Well, you can explain that to me then. I'll be happy to have you describe the difference there. If they're experiencing risky sexual behavior, what are you going to allow these community activists to educate them about?
Would you like to, counsel like to answer, or would you like me to answer?
I'm yielding back.
Thank you. I'll be happy.
I'll let you answer that one.
I'll be happy to answer. Look, when you look at page 2 and you look at the behaviors elicited there, obviously these are all things that we know that if people were educated about in a more comprehensive or a more effective way, we can reduce the bad health outcomes, and obviously we're trying to increase in the long-term cost efficiency.
In regaining my time, if you're talking about licensed professionals in a setting where maybe a parent had the ability to approve somebody talking to their child about risky sexual behavior, that might be one thing, but this is allowing organizations with community activity experience, groups like ACORN, who have very questionable legal backgrounds that are well documented, would have access using these federal funds to provide this experiential learning opportunity to a child, talking to them about risky sexual behavior, and nothing in here from what I can see even allows or requires parental consent. And so I would ask counsel, would it allow somebody, some community activist, to talk to a child about risky sexual behavior without their parents' consent? Or if you can show me where it's prohibited, because I surely don't see anything that would require parental consent for one of these community activists
Mr. Scalise,
to provide this outreach, quote unquote, on experiential learning opportunities.
I would just...
I'm asking counsel.
Oh, I'm sorry.
Mr. Scalise, there's nothing in this language that would prohibit or require parental consent.
So it would be allowed without parental consent. I know the ranking member had a question he wanted to ask. I would yield to the ranking member.
If I may, Mr.
Yeah.
May I continue?
Yes.
And as such, without addressing this directly, I would assume, looking at other laws of this sort, that applicable state laws would continue to apply, and that state laws governing parental notice and consent
So if a state does not have a requirement of parental
the
consent,
state
then
law
they would be
is
allowed.
silent on the point, then the federal law would not be, there would be no state government.
And then they could do it without parental consent unless the state had specifically prohibited, which many states haven't prohibited specifically.
I mean to say I see nothing in this provision that would
That
preempt
prohibits.
applicable state
Okay.
law.
And the ranking member, I know, had a question. I would yield to him.
I just want to comment on the eligibility on page 9, line 16. You know, I am not comforted by the gentlelady from Ohio's term explanation that the eligible entities are covered, because the definition of an eligible entity means any public or nonprofit private entity. Now, you've got some examples, but as it's currently written, this language, any public or nonprofit private entity in America qualifies. Acorns would qualify. So at the appropriate time, I'm going to ask unanimous consent to amend the eligibility with the phrase whose primary purpose is health education or treatment, so that we at least limit these grants to public and nonprofit private entities whose primary purpose is providing either health services or health education. So with that, I mean, that's just, the definition of an eligible entity is any public or nonprofit private entity in America, and that's it's a pretty broad net. I yield back to Mr. Scalise.
Mr. Scalise's time has expired.
Yield back, Mr. Chairman.
Ms. Christensen?
Thank you, Mr. Chairman. I'd just like to try to respond to the ranking member. I think to define it by those who normally provide services in healthcare may be too limiting. We'd be limiting a lot of not-for-profits that are associated with churches who have been getting very involved in health outreach, and many, many worthy organizations that just have the trust of the community, and with the training in healthcare, they'll be able to provide those services. I think to just limit it to those who are now providing healthcare.
Well, the gentlelady yield? If y'all withdraw this and we can have a discussion over the next several hours or maybe we can come up with a definition. I have no problem if you want to put faith-based organizations. I can live with that. But your current eligibility, I would hope even the authors would admit, is extremely broad.
And just reclaiming my time for a minute, and where we have the priority in awarding grants and we talk about have documented community activity and experience with community health workers, I think that's the more specific criteria, that they have experience with community health workers and have documented community activity, meaning activity within that community. We're not talking about, we are specifically not talking about people coming from an outside a community to go into a community to do this. We're talking about community organizations that are in that community, that have the trust of that community, and have had experience with training
But
health.
that's not
community
what your
health.
eligible entity definition says. It doesn't say that.
Will the gentlelady yield?
I'll yield to,
The gentlelady from Virgin Islands
Co-sponsor.
has the time.
I'll yield to my co-sponsor.
I thank the gentlelady. And again, I think that you're looking at one provision in the bill, but there are a lot of provisions here that are going to hopefully provide you with some assurance. When you look at the fact that it's an eligible entity to apply, there's a lot of oversight. I mean, when each eligible entity that desires to receive a grant shall submit an application and accompanied by such information as the secretary may require. This just doesn't happen willy-nilly here. It's going to have to describe the activities for which assistance is sought under the section, contain an assurance that with respect to each community health worker program receiving funds under the grant, such program will provide training and supervision to community health workers to enable such workers to provide the authorized program services, which are, of course, solicited in one of the provisions that we spoke about earlier. So, and as I said, there's also provisions to require, and the application is going to require an assurance that the applicant will evaluate the effectiveness of the community health worker programs receiving the funds. There's a lot of other provisions within this amendment that I appreciate your concerns, and hopefully these provisions address those concerns.
Will the gentlelady yield?
It's not my time. I yield back to the gentlelady from
Will the gentlelady yield to
Virgin
me?
Islands.
It seems to me that if you look at this secretary, in collaboration with the director of the Centers for Disease Control and other federal officials determined appropriate by the secretary, is authorized to award these grants to eligible entities for the purpose of promoting health behaviors. And then on page 3, there has to be an application to the secretary, and that application has to show they'll provide training and supervision to community health workers to enable them to provide authorized services, contain assurances the applicants will evaluate the effectiveness of their programs, contain an assurance that each community health worker program getting funds will provide services in the cultural context most appropriate. Then you have the oversight provisions. What was pointed out was page 9 describing eligible entity, which means a public or nonprofit private entity or consortium. Well, what was pointed out is that could mean anything, but it couldn't just mean any group. They're eligible, but then they have to meet the criteria set out by the secretary with the Centers for Disease Control to determine that they've got an application that they're going to do the job that needs to be done. And there are oversight provisions in this. It seems to me that there's a straining to try to find something wrong with what looks to me like a very good proposal. I don't know if ACORN would qualify or not, but just because they're a community organization doesn't mean they're going to get a grant. It has to be a community organization or people working with community organizations that can do the job. So I thank you for yielding to me, and I support the amendment.
Parliamentary inquiry.
Who seeks a parliamentary inquiry? Yes, gentleman from Arizona.
Can you tell me how many days of hearings we've held on this proposal? I withdraw the inquiry.
Gentlelady from Tennessee.
Thank you, Mr. Chairman, and I appreciate the recognition. And I do have a couple of questions for the author of the amendment. I think they can answer those, or Ledge Council can, and I appreciate their patience with answering the questions. Some of us who served in state legislative bodies as welfare reform was implemented know that as we sought to educate and train and involve people in the process, when there was the pool of money to help pay for this, we had some organizations that were not as well trained and not as well qualified who showed up wanting to participate in that process. Now, I've done lots of work with Children's Hospital and the Lung Association and the Arthritis Foundation and the Cancer Society and the Heart Association and organizations that have used volunteers to help educate and train people how to interface and how to take advantage of health care that was there for them, where to find that health care. But it is of tremendous concern to me that the way this is written, with any public or not-for-profit entity that has experience in community workers and community health workers can come in and apply. And it concerns me also on page 6, where you have your evidence-based interventions. And it says the Secretary shall encourage community health worker programs receiving funding under this section to implement an outcome-based payment system that rewards community health workers for connecting underserved populations with the most appropriate services at the most appropriate time. Now, we all like to see good work incentivized. I don't think anyone has a problem with that. But what about smoking cessation programs that maybe are not credible? What about alcohol and drug treatment programs that don't have the type outcome we would like, but yet maybe it's a not-for-profit that administers that? What about abortion services? What about the fact that they would be incentivizing any of these activities on page 2 that are listed, activity A through J? If you have a state that is not a parental consent state, what do you lay yourselves open to, and who would be expected to assume the liability? And I will yield to the bill's sponsor for a response.
First, let's clarify from council about some of the things that you ticked off there about being a part of the amendment. Certainly, abortion services are not listed as one of the provisions of the bill.
If the gentlelady will yield, I'll
Well, it's your
reclaim my
time.
time.
It's your time.
And ask council, would Planned Parenthood qualify for being a not-for-profit that could access these funds?
I don't know the answer.
I yield to the council.
If I'm making the assumption without knowing it that Planned Parenthood is indeed a private nonprofit entity.
Reclaiming my time. So they could be considered. And so the burden would then be on finding a way to exclude them from this. And I yield to the council. I can see he wants to make another comment.
Ms. Blackburn, the only activities for which funds are provided in this section are to educate and make referrals. There is no provision in this section for actual providing of service.
Reclaiming my time, and I realize that. And I also realize that sometimes it is that making the referral and being paid a bonus, if you will. If you look at page 6 to council, and they are going to be paid they will implement an outcome-based payment system that rewards community health workers for connecting underserved populations with the most appropriate services at the most appropriate time. So it would concern me that this is not defined in the language as what is specifically excluded and what groups are specifically allowed and are not allowed, and then that there would be that incentive program that was there. And my time has expired, and I yield back my time.
Gentlelady's time has expired. Mr. Wiener.
Let me just, first of all, if it's not clear enough to my colleagues that we want to assure quality, read the quality assurance section. If it's not sure that there's going to be monitoring, read the monitoring section. If it's not sure what criteria you'd have to face, read page 3 through 5. But let's not lose sight of the forest for the trees. If you're going to get control of health care costs, we can't simply provide health care to some communities in emergency rooms. We can't wait for someone who has stage 1 breast cancer to get to stage 5. It's too expensive. It's inhumane. It doesn't make any sense. I believe in everything I've heard from my Republican friends. They recognize that in their proposals, that we need to make sure we have different ways of providing health care, that we try to encourage people to get preventative care, for example.
We try to encourage people to live more healthy lives. That makes quality health care decisions, and it also saves money. What the gentlelady is proposing is to put some people at a relatively inexpensive cost, hyper supervised by the Department of Health and Human Services, to try to provide those services, to try to help steer people towards smarter decisions. If you're not, I mean, I have seen nonstop defense of the status quo, even the parts of the status quo you yourself say need to be changed. You know, you're so hidebound to protecting our health care exactly the way it is that even the most obvious flaws you're raising red flags about. Don't worry. ACORN isn't going to go register Democrats and give smoking exams. Don't worry about it. What we're trying to do here is fundamentally change the things that we're doing wrong in health care. You're so staring at the trees, you're losing sight of the forest. Too many people in this country are getting end-of-life care at the early stages of their life because we're not giving them smart health care options. Too many people have no other choice except to go into their neighborhood emergency room to get care. It's not, you may not care about them. Don't. Care about us. It's our tax dollars that's paying. It's our insurance that's going up too high. It's our doctors that are stuck taking care of them rather than doing things that are smarter from a monetary perspective. I mean, I understand you want to parse the sentence in the line, and I understand part of the strategy is drag it out as much as possible, raise whatever red flags you can. I mean, I am surprised ACORN came up in this debate, but it's obviously one of the talking points. But let's remember a little bit about what we're all trying to accomplish here. And I'm pretty sure it's in your plan, too. It's take healthcare decisions that are costing a lot of money and try to cut them off early by making ones that can save us a lot of money and also save people's lives. This list of things that's on page 2, do you think it's a bad idea to steer people away from bad nutrition? Is it a bad idea to steer them away from physical inactivity? Is it a bad idea to steer them away from being overweight and to using tobacco? Of course you don't. I know you don't. Even in the midst of all the political back and forth, you don't believe that. And so what Ms. Sutton is trying to do and what Ms. Christensen is trying to do is say, you know what, let's put some people in these communities supervised, chosen by the department after a long list of qualifications they need to meet, and try to achieve those things. I mean, I understand you're in love with the status quo, but I got news for you folks. You're all alone. Nobody else thinks the status quo is the best way to provide health care, and Ms. Sutton is recognizing that that's the case. So if you have a technical thing with the bill, that's one thing. But I would encourage you all to begin your remarks by saying, Ms. Sutton, great idea. We do need to do these things. Ms. Sutton, you're doing a great thing. We do need to change the way we provide health care in this country. If we get stuck in the same exact paradigm year in and year out, and we're looking for goblins in these bills in the form of ACORN or whomever else, we're never going to solve these problems. We're having a markup here, so if no one else says it, Ms. Sutton, Ms. Christian, this is a good idea. That's why we're going to pass it, and we're ultimately going to improve health care.
Will the gentleman yield?
Sir, I'll yield to whomever.
Right here.
Sure, just line up.
Mrs. Sutton,
yes, sir.
Ms. Sutton, that's a great idea. The deficit this year is over $1 trillion. Thank you.
That's right, and I'm just reclaiming my time. If you want to start to get health care inflation
Will the
under control,
gentleman yield?
Here, let me just respond to the gentleman's point. I'm not 100% sure what it was, but let me try to respond to it. If we want to try to get health care expenditures under control, we have to not be spending all of this money after people have started smoking, after they become obese, after they've made the wrong health care decisions. We have to try as best we can to use our doctors, use our health professionals, and use our community organizers to try to steer towards less expensive.
Will the gentleman yield?
Certainly I will.
Yeah, the problem is this proposal, as it's scored, it shows massive increases in government spending that sure to increase the deficit, not reduce it.
Wait, request unanimous consent for 30 additional seconds just to respond.
Yeah.
Without objection. I have to tell you something. This is a fundamental conversation. We're going to have it throughout the night, I think. We are going to be spending some more money now on some things, but we are in the aggregate going to be saving a lot of money. Because the amount of money...
If the gentleman will yield, show me how Medicare and Medicaid is done.
I'm going to tell you how.
If the gentleman would yield, do you have an example?
Time out. Let me finish my response. Let me finish.
Gentleman from New York has the time.
Let me explain how this is going to work. Right
Just
now,
expired.
Which has expired.
Gentleman from New York without objection.
Well, let me
recognized for
just
another
say,
10
you know,
seconds.
I'll give you an example. In your state of California and my state of New York, we spend billions of dollars on the uninsured, billions of dollars of people who are getting the most expensive type of health care. So yes, we may provide $1 more of health care and $1 more of community outreach to prevent $5 in lower taxes in California, and Lord knows they need them.
But no economist is with you on
that's
these spending
ridiculous.
projections.
That's ridiculous.
No economist is with you.
Everyone I know, including, you know, I saw Mr. Steele as
Gentleman's
the Republican
time.
Party give a speech
Go
today.
ahead.
where he encouraged things.
Gentleman's time has expired. Oh, I'm glad he spoke, because we got a lot more people now
Well,
ready to
Anthony
speak on
has
this
a
amendment.
way of doing that.
Chair recognizes Mr. Barton.
Mr. Chairman,
And he can-
Texas.
Mr. Chairman, could I get a second reading of his speech? I was asleep the first 30 minutes.
Mr. Barton.
Yeah. Well, some of what my distinguished friend from New York City said, I agree with. I think Congresswoman Sutton and Congresswoman Christensen, or Dr. Christensen, have a good idea, but it needs some work. You'll notice in the Republican suggestions or debate on this amendment, we're not saying it's a bad idea. We're saying let's try to perfect it. Now, I do, and I think it's a legitimate concern about the eligibility. As it's currently drafted, it's any public or nonprofit private entity. Now, let me give you a good example that would. My wife works for John Peter Smith Hospital, which is a public Tarrant County owned and operated hospital. They have community health centers. They have health-based clinics in schools, in kindergartens. They have outreach community centers all throughout Tarrant County. They provide services even extraterritorially outside in some of the rural counties that don't have a public hospital. They would obviously, they're a public nonprofit, they would qualify. And hopefully they would apply for a grant and they would get the grant. But let me give you some other examples in my district that under this definition would also qualify. And they're not acorns. I'm not talking, the Little League would qualify. The Girl Scouts and Boy Scouts would qualify. There is a group that puts on a 4th of July parade that is a public nonprofit. They work with the community health groups, providing health outreach for the people that watch the parade. They would technically qualify. Now, all we're saying is if you're going to move forward with a good idea, prevention, wellness, underserved communities, all the things that they talk about in the first part of the bill, help us define the eligibility to those groups that have some proven record of interacting with underserved communities in a health-related or some sort of a field that you want to. We're just saying this is too open-ended. That's all. And if you don't want to withdraw the amendment and work with us for the next night or the next day, just because the Republicans are sitting here saying, let's think about it, doesn't mean that we don't support it. But what my friend from California, Mr. Radonovich, said earlier, we do have a huge deficit. And you're providing grants, and when you're going to provide a grant, you're going to provide money. If you have a wide open eligibility of those groups that can apply for it, and you don't constrict it, you don't try to define it in a little bit more precise way, pretty good chance some or a lot of that money is not going to be very well spent. That's all we're saying. And I'll be happy to yield to Dr. Murphy.
Thank you, Mr. Barton. I guess I want to speak more as a psychologist here than as a member of Congress. And as the days heat up here and as the night goes on, I get concerned that we're confusing intent with content. And we have occupied a lot of time in the last couple hours arguing about intent. So I would suggest that we get back on track and don't argue about what's in persons' minds or hearts, their intentions. Because good ideas don't necessarily make good law, and sometimes good laws are hard to swallow. I also think there's a lot that is in this, and I certainly support a lot that is in this amendment. But given that this is the biggest health care bill this nation has dealt with in the last half century, and its implications are going to carry us another half century, I hope that we can stick to the issues at hand. And with that, I yield back to the chairman.
Get back to me. Okay, I once again want to ask the authors of the amendment if they're willing to either withdraw it so we can tighten up the eligibility requirement, or work with our staffs very quickly to see if we can come up with something that we can put in the amendment.
Will the gentleman yield to me?
Be happy to.
Why not adopt this amendment, and if you have further changes, you can talk to the authors, and we'll have those as an amendment later on.
Because we don't have an assurance that there will be a productive exchange if we accept it as is.
Joe, would you yield for one
Sure.
minute?
Be
Or
happy
a
to
few
yield.
seconds? Because if I'm in a position where I'm going to be voting to give Planned Parenthood money, even though that may not be, Anthony, the intent, but clearly they will, or ACORN or others that we don't think, and we have an opportunity to sit down, Mr. Chairman, and maybe agree on public hospitals and recognized health centers as the conduits, then I think we could come to an agreement. But right now, I'm not in a position where I could vote for it.
And
Time has expired.
Mr. Chairman.
Who seeks recognition? Anybody on the Democratic side? Who on the Republican side? Mr. Deal.
Thank you, Mr. Chairman. I'd like to engage council in a colloquy. If you would look at page 2 of the amendment beginning on line 20, it provides that one of the purposes for which these grants could be given is to educate and provide outreach regarding enrollment in health insurance, including the state children's health insurance program. Can council tell me if we did not have funding in the S-CHIP reauthorization that this committee and Congress passed to do exactly that in the S-CHIP bill? And if so, to what extent do we fund that?
It is my memory that there is outreach and enrollment activity funded in the S-CHIP legislation. I do not have it in memory how much money, or if it's indeed set aside as a discrete amount.
And then the next part is to do the same thing with enrolling in Medicare. Is there not funding already in the current Medicare law?
Yes, sir.
To do that? And also in the content of this bill on page 414, where it's talking about linguistic issues and giving priority to community organizations for enrollment in Medicare, on page 414 of the underlying bill, there's authorization for grants in the underlying bill for Medicare enrollment, is there not?
Yes, sir.
So we've got it in the existing Medicare law, we've got it in another portion of this bill, and now this amendment seeks to add a third time to fund the very same thing. And the third category is Medicaid for enrollment there. When we expanded Medicaid eligibility, we also included, and there's significant money in Medicaid for states to have outreach. In fact, we reward states for their outreach and give them extra funding if they will increase their enrollment in eligible Medicaid populations, do we not?
There is significant funding available for outreach and enrollment under the Medicaid program under the category of administrative costs.
And this one proposes to do it again.
Yes, sir.
Thank you. I yield back.
Further discussion?
Mr. Chairman, I wonder, do we have a representative from the Congressional Budget Office in the room with us tonight? I just think it would be very helpful to get their opinion as to, we've heard a lot of testimony both sides, and some of these programs seem worthwhile, some of them do seem vague and duplicative, and we do have a problem with the amount of money we're spending in this Congress. We have a problem with the amount of money we're spending in this bill. I have previously tried to get H.R. 914 through. I'm blocked at the Congressional Budget Office because it costs $200 million over 10 years to train new primary care doctors, and yet we're hardly flinching at spending $150 million over 5 years to train community health workers. I don't know that we're really going after value here with what we're spending in this bill, and I just think it would be helpful to have someone from Congressional Budget Office help us with those decisions, and I would support Ranking Member Barton's request that we pull this offline for a short period of time and see if we can't work through some of these problems. And I'll yield back.
Gentleman yields back. Further discussion on the amendment?
Mr. Chairman?
Who's asking for recognition?
Right there.
Gentleman from Oregon.
Well, Mr. Chairman, if this is brought up to a vote right now, I suppose I'll reluctantly oppose it. You know, representing a district that's 70,000 square miles, you want to talk about underserved populations. I've got counties with no hospitals, no doctors, who have to cobble together every penny they can just to keep their clinics open. And then I hear from my other providers the desperate need for general practitioners, as referenced by Dr. Burgess. It seems to me if we've got an extra $150 million, putting it into actual delivery of service to people in need would be the best expenditure through the health clinics, through educating more general practitioners. Home health care. I've got home health care agencies that are having to pull back. You know, in the Medicare Part D legislation, we had a 5% add-on for rural areas for home health care that expired. We've not been able to get that renewed. I mean, there are a lot of promises and pledges out there already that are unfunded, and yet here we're going to apparently create another program that is not duplicative but triplicative of existing law in some cases. And so I'd just soon have us bring it back as well and get this worked out.
Gentlemen, yield to me?
I'd be happy to yield.
Sounds to me your argument is a bit different than those who are arguing we ought to clarify exactly who may seek a grant.
Well, I actually share that argument too, but I thought it had been well made. I didn't want to be quadruplicative.
But your argument that you just made focused more on the fact that this may not be the best use of funds.
I share both.
Given other needs. So I could understand both arguments. So withdrawing it for a short period of time may lead to pinning down and narrowing exactly who the grantees may be, but withdrawing it may not satisfy those who don't want to spend the money. So I think it's legitimate for you to oppose it on that basis. I do want to point out to the members of the committee that we've already adopted, over my objection, the ability for the Secretary to just unilaterally eliminate duplicative and even triplicative programs. So perhaps that can ease your mind.
Well, reclaiming my time, if the chairman doesn't mind.
I'm starting to like that proposal better.
Well, I'm just trying to reduce the workload on the Secretary, since if we approve this amendment, we'll knowingly be creating a triplicative grant program. So we can actually prevent that waste of the Secretary's time. We can save $150 million that could go to all kinds of groups without any great expertise in actually helping sick people. Now, I believe in this outreach. I got that piece. I just know ahead of that, there's a long line of people waiting to get access to care in facilities like the Asher Clinic in Fossil and, out in Nissa and around. I mean, there are lots of small communities in my district where a few tens of thousands of dollars could keep the lights on, the doors open, and care given. I think they'd rather have the money focused there than in some newly created federally funded outreach process.
Gentleman, yield back his time.
I do, sir.
Are we ready for the question? The vote now comes on the Sutton-Christensen amendment.
Parliamentary inquiry, Mr. Chairman.
Yes, state your parliamentary.
Is what we're doing experiential?
I'm not qualified or eligible to answer that question. Don't give me any grants to study it. We now vote on the Sutton-Christensen amendment. All those in favor of the amendment say aye. Aye. Opposed, no. The noes are dribbling in, but the ayes have it.
Mr. Chairman, I'd ask for a roll call vote.
Okay, we'll proceed to a roll call vote.
Mr. Waxman.
Aye.
Mr. Waxman votes aye. Mr. Dingle. Mr. Dingle votes aye. Mr. Markey. Mr. Boucher. Mr. Pallone. Mr. Pallone, aye. Mr. Gordon. Mr. Gordon, aye. Mr. Rush. Ms. Eshoo. Ms. Eshoo votes aye. Mr. Stupak. Mr. Engel. Mr. Engel, aye. Mr. Green. Mr. Green, aye. Ms. DeGette. Ms. DeGette, aye. Mrs. Capps. Mrs. Capps, aye. Mr. Doyle. Mr. Doyle, aye. Ms. Harmon. Ms. Harmon, aye. Ms. Schakowsky. Ms. Schakowsky, aye. Mr. Gonzalez. Mr. Gonzalez, aye. Mr. Inslee. Mr. Inslee, aye. Ms. Baldwin. Ms. Baldwin votes aye. Mr. Ross. Mr. Weiner. Mr. Weiner, aye. Mr. Matheson. Mr. Matheson, aye. Mr. Butterfield. Mr. Butterfield, aye. Mr. Melanson. Mr. Barrett, oh, sorry. Mr. Melanson. Mr. Melanson votes aye. Mr. Barrow, sorry. Mr. Barrow votes aye. Mr. Hill. Mr. Hill votes aye. Ms. Matsui. Ms. Matsui, aye. Mrs. Christensen. Mrs. Christensen, aye. Ms. Castor. Ms. Castor votes aye. Mr. Sarbanes. Mr. Sarbanes, aye. Mr. Murphy of Connecticut. Mr. Murphy, aye. Mr. Space. Mr. Space votes aye. Mr. McNerney. Mr. McNerney votes aye. Ms. Sutton. Ms. Sutton votes aye. Mr. Braley. Mr. Braley, aye. Mr. Welch. Mr. Welch votes aye. Mr. Barton.
Yes.
Mr. Barton votes aye.
I vote no, excuse me. Momentary brain lapse there.
Mr. Barton votes no. Mr. Hall. Mr. Hall votes no. Mr. Upton. Mr. Upton, no. Mr. Stearns. Mr. Stearns, no. Mr. Deal. Mr. Deal, no. Mr. Whitfield. Mr. Whitfield, no. Mr. Shimkus. Mr. Shimkus, no. Mr. Shattuck. Mr. Shattuck, no. Mr. Blunt. Mr. Blunt votes no. Mr. Boyer. Mr. Boyer, no. Mr. Radonovich. Mr. Radonovich, no. Mr. Pitts. Mr. Pitts, no. Ms. Bono-Mack. Ms. Bono-Mack, no. Mr. Walden. Mr. Walden, no. Mr. Terry. Mr. Terry, no. Mr. Rogers. Mr. Rogers, no. Mrs. Myrick. Mrs. Myrick, no. Mr. Sullivan. Mr. Sullivan, no. Mr. Murphy of Pennsylvania. Mr. Murphy, no. Mr. Burgess. Mr. Burgess, no. Ms. Blackburn. Ms. Blackburn, no. Mr. Gingrey. Mr. Gingrey, no. Mr. Scalise. Mr. Scalise, no.
Yes, Mr. Boucher. Clerk will
Mr.
recognize
Boucher.
other members.
Mr. Boucher votes aye. Mr. Markey. Mr. Markey votes aye. Mr. Rush. Mr. Rush votes aye. Mr. Stupak. Mr. Stupak, aye. Mr. Ross. Mr. Ross votes aye.
Have all members responded to the call of the roll? If so, the clerk will count the votes. Clerk will announce the vote.
I am, sir.
On that vote, Mr. Chairman, there were 36 ayes and 23 noes.
36 ayes, 23 noes. The amendment is agreed to. Next amendment, Mr. Rogers.
Thank you, Mr. Chairman. I have an amendment at the desk. I believe it's listed as 319. Correction, it's Rogers 1.
Will the
also known as 319.
will the clerk report the amendment?
Amendment offered by Mr. Rogers of Michigan.
Without objection, the amendment will be considered as read. Gentleman from Michigan is recognized on his amendment for 5 minutes.
Thank you. This is, again, a very, very simple amendment. It follows along what Dr. Gingrey had offered earlier on best practices, and I think gets to the heart of many people's concern about a government-run plan. And I think we can all agree that comparative effectiveness research can be a useful resource for doctors and patients, but it should not be used as a tool to limit coverage or deny treatments. This bill creates an entire new federal regime to conduct comparative effectiveness research, and alarmingly, the bill in its entirety has no restrictions on how the federal government can use that research. None. This is a dangerous open-door policy that will almost certainly lead to CE research being used to make coverage decisions. Here's what CE comparative effectiveness can teach us. What treatments are generally more effective than others? Which procedures might work better for a particular disease than others? On which drugs have a bigger impact on treating one disease over another? All good things to have in the quiver of a doctor trying to make a decision. But this is important. That research is about general average assumptions. It can't determine anything about an individual patient with a unique condition in need of a unique treatment under the care of a unique provider. These decisions must be left to a patient and their doctor, with comparative effectiveness used as more resource, not a coverage mandate. And there's been lots of examples. I gave you my personal example in the previous debate. There was also recently a 46-year-old Montreal woman who was denied access to a particular cancer treatment that would keep her alive as she battled an inoperable form of colon cancer, and she was trying to prolong her life. This is a standard treatment in the United States of America. But Canada denied treatment, and here's what their ministry said, and I quote, because they wanted to see more prolonged survival rates, end quote. So the government made the decision, based on costs through things like comparative effectiveness and best practices, that they didn't want to spend the money. Now, the doctor was there, the family was there, the Canadian government. And if we don't put protections for doctor-patient relationships in this bill, it will happen as sure as we are sitting here. And people like me won't survive, this woman won't survive, and you'll have the cancer rate survival rates drop, just as they have in the United Kingdom and Canada. We can always find these tragic stories, but I tell you what, these patients deserve better, and they deserve the protection of a uniquely American system that will not ration care. So if you believe we shouldn't be rationing care, and we shouldn't be using these things to control costs at the lives and expense of our patients and their families, then this is a simple amendment of which we ought to adopt and adopt quickly. My amendment would ensure that research conducted by the bill's new task force for clinical prevention services and the Agency for Healthcare Research and Quality couldn't be used to determine coverage decisions for patients. This common sense protection must be included in the bill. Only doctors and patients should make these decisions about the treatments that are best for them, and not a government bureaucrat. And with that, I would yield back the remainder of my time, Mr. Chairman.
Gentleman yields back the balance of his time. Further discussion on this amendment? Mr. Murphy.
Thank you, Mr. Chairman. I certainly understand the talking point coming from the other side about the skepticism on information produced by the government relative to coverage decisions. But the gentleman's point about not wanting that information to inform a denial of coverage just isn't what this amendment does. This amendment bans any public or private insurer from using that information to evaluate coverage decisions So it basically says you can't use that information to deny, but you also can't use that information to add either. So let's think of a fairly routine scenario in which this agency that we're talking about here today makes a recommendation for a new preventative service that is an important addition to the standard of care. A new way to screen for cancer, for instance. Something that government agencies today, the CDC, the NIH, do all the time. Let's imagine that this agency makes that recommendation. If you are a medical professional running a public plan or a private plan under this amendment, and you happen to read that report, you are deemed illegally making decisions based on adding that new service to your plan if you happen to have read the government report. I have no idea how you'd even enforce this. I think it's a dangerous policy to basically say that if a government agency, this one in particular, makes an important recommendation to add or supplement a particular procedure that the insurance company can't do it, but I have no idea how you'd actually make this enforceable. How would you find out whether a individual running a private insurance plan as part of their decision-making process to add an important new screening provision took into their consideration, even 10% or 20% of their decision-making, the fact that they read some report from this Task Force on Clinical Preventative Services?
Will the gentleman yield?
Certainly.
Thank you. I'm not sure what amendment you're reading. I hope you read mine. It's pretty short. It's a paragraph long. But it clearly states in this amendment that it is only not to be used for supporting or developing by the task force, and let me get the exact words here, to account any coverage determination or used to evaluate any coverage requirements. In other words, you cannot say, you can't use comparative research to figure out what will or what will not be reimbursed, and you can't use it to set reimbursement levels. That's very clearly different from what the gentleman is saying. Again, I wouldn't oppose that you have to do the research and keep it secret. That would defeat the purpose of the research, and I happen to think the research is a good thing. But what we need to do is make sure that they don't use a good thing in general terms to punish patients and doctors in their relationship by setting reimbursement rates and what is and what is not covered. And that's very simple in the
reclaiming my time, I guess I just don't read the phrase used to evaluate any coverage requirements as only applicable to coverage denials or limitations. I think when you use a phrase as broadly defined as evaluating coverage requirements, that certainly could be read by someone setting up a private or public insurance reimbursement plan to prohibit them from using this information to make additions.
Well, gentlemen, if we did unanimous consent to strike, evaluate, and put deny, would that help the gentleman?
Reclaiming my time, I think the underlying concern here is that to the extent that there is a fear that the underlying bill would lead to these denials being made on the information coming from these new agencies, in particular this Task Force on Clinical Preventative Services, I just encourage my friends to read the bill. There is absolutely no enforcement mechanism right now in the underlying bill, so even if this was drawn as a limitation on denials, I don't think it's necessary. Mr. Chairman, I'll yield back the balance of my time.
The gentleman yields back the balance of his time. Ms. Myrick?
Thank you, Mr. Chairman. I just wanted to speak in support of this amendment, and actually I think Mr. Barton's suggestion of changing the word to deny is a very reasonable one. But as a cancer survivor myself and someone who works all the time with cancer patients, everybody's different. And I would hate to see I support comparative effective research is a good thing, but I would hate to see that used in any way in being forced to make decisions on a particular person and their case. So I just wanted to add that to the discussion, and I would hope that the chairman might consider that word if it would make a difference in the amendment. And I yield back.
Further debate?
Mr. Chairman.
Mr. Braley.
Mr. Chairman, I want to strongly oppose this amendment, and I think it's important for everyone here to understand that the Prevention Task Force defined on page 944 of the bill under section 3131 doesn't do comparative effectiveness research. It doesn't do any primary research at all. And in fact, over 20 years, the U.S. Preventative Services Task Force has built a reputation for impartial, science-driven recommendations about what works in prevention. And I want to emphasize again, the task force does no original research. It merely reviews the scientific literature to determine what works in prevention. The amendment that's being offered would prevent any insurance company from considering the recommendations of the task force. It would limit the ability of insurance companies to cover things like breast cancer screening, cervical cancer screening, colorectal cancer screening, all of which are currently recommended by the task force. Finally, the amendment seeks to solve a problem that doesn't exist. Medicare can extend coverage to services recommended by the task force, but it cannot deny coverage to services that aren't recommended. The new Benefits Commission must cover task force recommendations, but may cover any preventative service. This bill does create a new permanent center for comparative effectiveness research in Division B of this bill, which we are not debating right now. We should have a debate about comparative effectiveness research. I look forward to it. That debate, however, should belong where it belongs, and that's in Division B. It shouldn't happen in the context of the clinical task force, which simply doesn't engage in any of the sort of comparative effectiveness research that is the subject of this amendment, and I'll yield back.
Gentleman yields back the balance of his time. Mr. Terry.
At this point, I'd like to yield to Mr. Rogers.
Thank you, and I appreciate the gentleman's argument. I just want to refute you. And why this, I think, is so important to building these protections for patients and doctors is it clearly states under page 937 under the Prevention Task Forces that they will review the scientific evidence related to benefits, effectiveness, appropriativeness, and costs of clinical prevention services identified under this paragraph. They clearly use the science that's based on that. And if we don't build in the protections, I guarantee you, as they have done in every other government-run healthcare system in the world, they use it to ration care. Let's just build in the protections. We're all agreeing on the same thing. Research is good. And in a general sense, doctors should have it available as soon as they can get it in their hands. But they shouldn't put it in the hands of the people who are going to make the determinations if you can have it or not based on what your cost is or by what some artificial standard is, so that some people, as they have in every other country, maybe even here, could have fallen through the cracks.
Gentleman from Michigan, yield to me.
I'd yield to, who's seeking recognition?
I have the time. I'll yield to you.
Yeah.
Mr. Chairman, you wanted to yield?
Oh, Mr. Terry, you had it.
Yeah, I
Yes,
had the
thank you.
time.
Well, I was reading the language, and it says, take into account any coverage determination. So if there's effectiveness research that indicates that there ought to be a service covered, that would be prohibited? That seems like a strange conclusion. Or evaluate any coverage requirements. Suppose we think that there ought to be a certain screening program to prevent a disease, and the private insurance companies want to take that research and provide that additional coverage. You were talking about denying coverage, but this would also deny new coverage as it may be determined. And then determine or evaluate reimbursement levels. Well, I don't know. That would be something I think makes some sense. But the others, if you read them literally, could have exactly the opposite effect of what you've argued.
Reclaiming my time and yielding to Mr. Rogers
And I think
as your moderator for the day.
And what I think worries me most about your comment there, Mr. Chairman, is you said you don't have any problem with reimbursement rates. That's exactly what gets the other countries in trouble, right there. And why we ought to put this protective language in the bill. And it doesn't do it proactively. It says you can't go back and say, I am not going to cover bladder cancer for a 19-year-old because it doesn't fit the profile. What it does say is that we will provide coverage in association. It doesn't prevent that in any way, shape, or form because there are unique circumstances. And so you're trying to take comparative effectiveness and lay it over into individual cases in this bill. That's what you try to do and will happen in this bill. And what we're saying is comparative research is good, but don't use that as your template to set up what coverage reimbursement, which you said you don't have a problem with. Fundamentally, I have a huge problem with that. I think that's what inhibits doctors.
Well, Mr. Terry, yield to me further.
I would yield back to Mr. Terry.
Yes, reclaiming my time and yielding to the chairman.
Thank you. Well, I don't want to say that I'd never be for determining reimbursement levels, but I don't think we're anywhere near this sort of thing. I think comparative effectiveness ought to be to advise people on the latest research to see what's effective. I don't think we ought to be talking about reimbursement levels, but it could well be that if you find some medical procedure that is just so ineffective, and we know it's ineffective because it's outdated, why shouldn't an insurance company say that we're not going to pay for it any longer? I think that's a reasonable approach. I wouldn't want to say they couldn't even use it for that. So I just think that whatever you're trying to accomplish, it's too broadly drawn and might be counterproductive. So I just want to point out those reasons why I would oppose this amendment.
Would Mr. Terry,
Yes, I would like to yield to Mr. Barton.
in his supreme moment of controlling the entire debate in the Energy and Commerce Committee, yield to the ranking member? You know, time after time in this debate so far, Mr. Chairman, Republicans on the committee have taken the majority at their word. We've read the bill, we take the plain language, and if we see an anomaly or a problem, we've offered amendments to try to correct it so that the bill actually reflects what we take at face value is the intent of the majority who's drafted the bill. And that's what Mr. Rogers is doing. And y'all appear to be opposing him because you apparently don't really believe the language in your bill. You really wanted to do something else, but when we try to limit it to what you say you want to do, you oppose it. You know, comparative research is about research. You know, if you believe in transparency and you believe in the market and you believe in people having the appropriate amount of information, making the appropriate decision, all you've got to do is publicize the comparative research, and the healthcare community will take it from there. You don't have to put mandates. You don't have to make decisions that limit free choice and free will in the public healthcare marketplace. And that's all Mr. Rogers is attempting to do. He's taken the majority who drafted the bill at their word. So I would support the Rogers amendment. And I thank Mr. Terry for yielding.
Are we ready for the question? Any further debate on this amendment? All those in favor of the amendment offered by Mr. Rogers of Michigan will say aye. Aye. Opposed, no. No. Well, we're probably going to have a roll call vote. We might as well get to it.
Mr. Waxman?
No.
Mr. Waxman, no. Mr. Dingle? Mr. Markey? Mr. Boucher? Mr. Pallone? Mr. Pallone votes no. Mr. Gordon? Mr. Rush? Ms. Eshoo? Ms. Eshoo votes no. Mr. Stupak? Mr. Stupak, no. Mr. Engel? Mr. Engel, no. Mr. Green? Ms. DeGette? Ms. DeGette votes no. Mrs. Capps? Mrs. Capps, no. Mr. Doyle? Mr. Doyle, no. Ms. Harmon? Ms. Harmon, no. Ms. Schakowsky? Ms. Schakowsky, no. Mr. Gonzalez? Mr. Gonzalez, no. Mr. Inslee? Mr. Inslee, no. Ms. Baldwin? Ms. Baldwin votes no. Mr. Ross? Mr. Weiner? Mr. Weiner, no. Mr. Matheson? Mr. Butterfield? Mr. Butterfield, no. Mr. Melanson? Mr. Melanson, no. Mr. Barrow? Mr. Hill? Mr. Hill votes no. Ms. Matsui? Ms. Matsui, no. Mrs. Christensen? Mrs. Christensen, no. Ms. Castor? Ms. Castor, no. Mr. Sarbanes? Mr. Sarbanes, no. Mr. Murphy of Connecticut? Mr. Murphy, no. Mr. Space? Mr. Space, no. Mr. McNerney? Mr. McNerney, no. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley, no. Mr. Welch? Mr. Welch, no. Mr. Barton? Mr. Barton votes aye. Mr. Hall? Mr. Hall votes aye. Mr. Upton? Mr. Upton, aye. Mr. Stearns? Mr. Stearns, aye. Mr. Deal? Mr. Deal, aye. Mr. Whitfield? Mr. Whitfield, aye. Mr. Shimkus? Mr. Shimkus, aye. Mr. Shattuck? Mr. Shattuck, aye. Mr. Blunt? Mr. Blunt, aye. Mr. Boyer? Mr. Boyer, aye. Mr. Radonovich? Mr. Radonovich, aye. Mr. Pitts? Mr. Pitts, aye. Ms. Bono-Mack? Ms. Bono-Mack, aye. Mr. Walden? Mr. Walden votes aye. Mr. Terry? Mr. Terry, aye. Mr. Rogers? Mr. Rogers, aye. Mrs. Myrick? Mrs. Myrick, aye. Mr. Sullivan? Mr. Sullivan votes aye. Mr. Murphy of Pennsylvania? Mr. Murphy votes aye. Mr. Burgess? Mr. Burgess, aye. Ms. Blackburn? Ms. Blackburn, aye. Mr. Gingrey? Mr. Gingrey, aye. Mr. Scully's? Mr. Scully's, aye. Mr. Rush? Mr. Rush votes no. Mr. Boucher? Mr. Boucher votes no. Mr. Dingle? Mr. Dingle votes no. Mr. Matheson? Mr. Matheson? Mr. Matheson votes no. Mr. Green? Mr. Green votes no. Mr. Markey? Mr. Markey? Mr. Markey votes no. Mr. Barrow? Mr. Barrow votes no.
Have all members responded to the call of the roll?
Mr. Ross? Mr. Ross votes no.
Clerk will tally the votes. Clerk, ready with the vote?
Yes, sir. On that vote, Mr. Chairman, there were 23 ayes and 35 nays.
23 ayes, 35 noes. The amendment's not agreed to. Ms. Capps, you seek recognition for an amendment?
Yes, Mr. Chairman, I have an amendment at the desk.
Clerk will report the amendment.
It's titled Waxman 1. But it's not Waxman who's...
I wonder where the chairman is on this amendment.
Is that the one I changed my mind about?
We'll find out.
Amendment
Yes.
offered by Mrs. Capps of California.
Without objection, the amendment will be considered as read, and gentlelady from California is recognized.
Reserve a point of order, Mr. Chairman.
And Mr. Scalise reserved a point of order.
As members are receiving copies of the amendment, perhaps I could begin to discuss it. This amendment would establish a grant program through the Centers for Disease Control, CDC, to support or conduct evidence-based education programs to reduce teen pregnancy or sexually transmitted diseases and to promote healthy adolescent development. health education, and prevention are at the core of setting young people on a course for a healthy life. During my many years as a school nurse in a local school district in California, I learned this firsthand. But we are failing when 1 in 3 girls in the United States gets pregnant at least once before the age of 20. And just this past Friday, the CDC released a report showing troubling trends in adolescents' health. The teen birth rate, which had been declining since 1991, began to increase again between 2005 and 2007. And we are failing if half of all new sexually transmitted infections occur among young people aged 15 to 24. Again, the same study from the CDC includes information about the rate of AIDS diagnosis among young men aged 15 and 19, and that it has doubled over the past 10 years. One thing we can do to reverse this trend is to invest in evidence-based programs aimed at teen pregnancy prevention, and that's what this amendment would do. The Healthy Teen Initiative, as it's called, would give money to states to implement or support education programs that have been demonstrated to delay initiation of sex and reduce teen pregnancy, sexually transmitted diseases, and risk behaviors that lead to them. States would be allowed to award grants or contracts to public or private nonprofit entities, including programs or community schools or community organizations, to conduct these programs. It would require independent evaluation of the programs and require that they demonstrate that they be medically accurate and age appropriate. This initiative makes it clear that it would not in any way preempt state laws regarding parents' involvement and decision-making in their children's education. If a program, now any program, comprehensive, abstinence-only, or any program, is medically accurate, age-appropriate, and evidence-based, it will be eligible for funding. I want to stress that the amendment does not make any requirements about the content of the program, but rather a series of criteria that any program must meet. This program will be an important addition to overall prevention and wellness efforts that are being initiated through the underlying legislation. So I urge my colleagues to join me in supporting this amendment. And now, with some remaining time, well, I'm happy to either yield back my time or yield it to anyone else who wishes to speak on the topic. I'll yield it back. Or could I
ask a question?
Stupak. Certainly.
Would your program then eliminate the abstinence-only program?
No, in fact, it could include it. Any program is eligible for the funds if they meet the criteria.
But it eliminates Title V, right? Because that's where a lot of the abstinence-only money is found.
No, it doesn't eliminate anything. It's a grant program.
If you don't reauthorize it, then it's basically dead then, right? I mean, Title V is only, it expires, I believe it's this year. So, and you don't reauthorize it, so therefore you basically do away with the abstinence-only funding.
This doesn't deal with Title V. It's an amendment aimed at prevention and authorizing the CDC.
Well, okay. So you're saying you're silent on Title V?
It's a totally separate program. I am silent. This amendment is silent on Title V.
Okay.
Would the gentlelady yield?
I will yield to...
At the beginning of your amendment, it says at the end of Title V, a Division C is added the following. Mr. Stupak asked a question, and you said it has nothing to do with Title V. Mr. Stupak was asking...
Title V of this bill, not the Title V that I believe Mr. Stupak was referring to.
The gentlelady, I ask you yield to me.
Of course.
Thank you. I appreciate. Now, there's already under sex education, which I forget which Title III of not this bill, but TANF, I think. But that is extraordinarily similar to this. So my question is, isn't this duplicative of already existing sex education programs?
To my knowledge, there is no program that is set up for evidence-based criteria.
All right. So the sex education, whether it's an abstinence-based or the others, are not evidence-based?
No.
Even though that's been the argument against the abstinence
They have to
by
meet the criteria to apply for these grants.
And this is the criteria set by the CDC.
Right.
And this is an additional $50 billion. Million.
Million.
50 million for 4 years. But it seems to be, even though it's based through the CDC, it basically is going to be the same type of education that's already in the sex education funding programs.
No, those are not evidence-based, at least not specifically according to the criteria.
What do you think it would take under your bill to become evidence-based?
It's not for me to decide.
It's for the CDC.
Exactly.
Don't you think that all of the sex education are using evidence within their program?
Pardon? There is no evidence to that fact.
That they're using evidence. Okay.
Gentlelady's time has expired. Mr. Murphy.
Thank you, Mr. Chairman. With the gentlelady from California, yield for some colloquy on this. We had just addressed Ms. Sutton's amendment, which included in here for these community educators to include working on risk behavior factors, including risky sexual behavior. This seems to overlap with that. How is it? Is it duplicative? Are they entirely different? Are we going to have two teams of people out there working on this in the community?
This is an educationally based program that is that a state would apply for funds for.
I understand. Where would these educational sessions take place?
Usually through a school setting.
Should we define that in the bill that it's at a school setting?
No, because it could be. It's left to the discretion.
And I'm back here. I go back to the one that Ms. Sutton had too. Do we know where those sessions are supposed to take place? Those education sessions with people involved with risky sexual behavior?
Is this a question for me?
Yes, because I'm trying to balance these two that we're not just duplicating with more millions.
I think one isn't out, to my knowledge. I'm not an expert on Ms. Sutton's bill or Ms. Christensen's bill. Those are outreach programs. This is an education-based program.
Well, the other thing, I'm hoping this has to do with education because it's educate, guide, and provide experiential learning opportunities. Although I don't know what experiential learning opportunities have to do with sexual behavior and Sutton's, but I'm concerned here too that neither one, unless I'm mistaking something, do you define the qualifications of persons who are going to go out there and teach kids about sexual behaviors?
No, I define this as something that we've already experienced through health education classes in school settings, and those are sometimes taught by credentialed school teachers or nurses, but they are sometimes designed by the state to bring in physicians from reputable clinics and other people who can provide this education.
Would you be willing to work on something here that either now or later that adds some strength to this? I would think a lot of parents would be concerned that people out there without any defined professional qualifications would be able to do these classes. I like your idea of saying these have to be some with nurses or some medical certification.
I didn't say they had to be. This is for states to decide, and it already specifically says that states that allow parents to be involved in the decision making, either in the particular curriculum that their school district uses, or in whether or not their child shall participate.
I understand that. What I'm deeply concerned about is who is teaching the children about sex, and if you're going to provide this grant to the states, I'd be very concerned it doesn't come with some strings attached saying it just can't be any person who wants to teach sex education. It ought to be someone with some professional qualifications.
It isn't up to the CDC to determine who is the teacher. Those are state contracts or community contracts.
Right.
It is up to this program is designed to make sure that criteria in whatever curriculum is used. It's curriculum that is being evaluated in terms of its criteria by the CDC.
Well, another thing here, I'm assuming you talk about evidence-based medicine, and I'm assuming that evidence means that this program should also be subject to evidence-based medicine, but I don't see requirements in here that there should be some proof of outcome that it actually
reduced initiation of
Yes.
sex, decrease the number of partners, reduce teen pregnancy.
That is actually a requirement. That's part of the evidence.
But I mean, so does it say, unless I'm missing it here, but I just got the amendment, does it say somewhere in here that if an organization or a state failed to reduce those issues, that they would not get their grant money?
I would believe that would be lack of evidence.
I just don't see it in here. That it doesn't necessarily
on
say in here that if they
page
fail
line
to reduce,
20.
is it in here somewhere that I missed?
Page 2, line 20, describe how the state's proposal will address the needs of at-risk teens in the state.
I understand,
And
but
then identify
addressing
the
and actually
evidence
coming up with evidence.
Will the gentleman
Gentleman
yield?
yield.
I'm just trying to find that, yes.
Will the gentleman yield? Page 3, line 11, E, evaluation through line 20. That's where it addresses those concerns.
Well, it says that they have to independent evaluation. It says they have to submit a report. It doesn't say that if they fail to do that, they're not eligible for more funds.
Well, they are not eligible.
Can
They
we-
have to produce the independent evaluation. They have to be evaluated. The CDC is in charge of the evaluation.
In my remaining time, would the gentlelady be amenable to perhaps putting some wording in this that specifically says that if they're not able to produce results,
I
they
believe
don't
it's clear in
continue?
the amendment, sir.
It's not in here. I'm
Page
still
4,
looking for it.
line 3.
Page 4 now? See, people told me it's page 2 and page 3. Now it's page 4.
The whole amendment deals with what you're talking about.
There's nothing in here that specifically says if they fail to meet the goals of this under the definition, that they're no longer eligible for funding.
Well, I believe it does, sir.
Well, I understand your belief, and I highly respect
it's a
your
several
profession. I'm
different
just
way.
trying to find where it specifically says that, because we're spending $50 million, and the taxpayers ought to know that if we're spending that, we're demanding some outcome-based medicine here.
First of all,
Please.
the curriculum is submitted
Yeah?
for evaluation and documentation that the criteria are met.
Mhm.
These are evaluated by the Centers for Disease Control, and the CDC then publishes a list of those that have been evaluated to meet the criteria. Of those curricula that have been approved, the states may choose, or the individual school districts may choose.
I understand all that. I still go back to this point. I know I'm out of time here, but that if they don't produce results to reduce the very things you
They
state,
cannot be, they don't meet the criteria.
then they would not be eligible for further funds. I would
Exactly.
still think that would strengthen it and make it more amenable to taxpayers. And that I yield back. I'm sorry, Mr. Chairman.
Mr. Chairman?
Yes, gentlemen.
Mr. Chairman?
Who seeks recognition? Mr. Stupak.
Thank you, Mr. Chairman. Mr. Chairman, in reviewing this amendment, I reluctantly going to have to oppose this amendment. If I go back and if I remember when we did the 2010 budget, the president's budget, he really took all the money out of abstinence-only education. And the proposal that the president said he's going to redirect all funding to a new teen pregnancy prevention initiative that uses comprehensive sex education curriculum. My problem is comprehensive sex education curriculum receives right now underneath the budget about 12 times more money than abstinence-only does.
Yes.
And abstinence-only education uses the A through H model, which the Catholic schools use. And I think you would then, if the president fulfills his promise, you'd get rid of that money for abstinence-only, and the Catholic schools would be left out. The A through H program would be gone. We only spend 1/12 of the money we do for comprehensive sex education. So I think this program would really be targeted towards abstinence only. It would get rid of it, the little bit of money we do spend for it. And if we go back and if we look at the first amendment we passed here in this committee on this markup last Friday, the Sullivan Amendment, does this then become a duplicative program, which we said the Secretary would then have to close out? So I can see a number of problems here with this amendment, so I'm going to oppose it. And
Would the gentleman yield?
Sure.
Thank you to my friend from Michigan. This is a separate grant program from whatever you're describing that the president has or has not authorized. To my experience, there are many abstinence-only programs being used in communities that I have represented and places that I have visited. I've seen them. There are now going to be criteria. If states wish to apply for the funds for the implementation of programs abstinence-based only. Any program is qualified to apply if it meets the criteria that are set out by the Centers for Disease Control. Then it can be eligible for the grant funding. I don't think it replaces anything that you might be talking about.
Well, reclaim my time. I know we haven't done labor HHS bill right now, but it's my understanding there is no abstinence-only money in the labor HHS bill, which we're going to take up later this month. So how is your bill really anything different than the 2010 budget proposal that we did, in which the president's budget did away with abstinence only and put it in this comprehensive sex education program, which now receives, as I said, $12 to every $1 abstinence only. You may not agree with abstinence only.
I'm not taking
and I'm not debating those merits, but it's another tool we use. So why would you put forth an amendment that gets rid of the little bit of money we spend on abstinence only to start another program
This
with
does
new
not
criteria?
replace any funding.
And I really don't see how the new criteria is any different than that of what the president called for in the 2010 budget proposal he did, or in the proposed language that I've seen for labor HHS. So that's my reluctance to support this amendment, and I'd hope in this area we would leave as is. You know, there are over 500 abstinence programs we're using now in the United States, and that's why the Sullivan amendment that we voted for the other day made some sense. If we have duplications in these areas, maybe we should get rid of them. And now we're adding another program, so I guess we could see if we pass your amendment, we now have 501 different.
Excuse me, this is not a program. This is establishing a grant.
Well, once they give you the money, reclaiming my time, it becomes a program. I mean, you don't give grants for the heck of it.
But this is not a curriculum. This is to establish, this is to deal with prevention. When we see the numbers rise of teens getting pregnant.
Right. Reclaiming my time. You're right. The last 2 years, teen pregnancies are up. We only had abstinence only since 1996. The first 12 years, teen pregnancy went down. The last 2 years, they've gone up. So you can argue either way, but I would tend to argue abstinence only in some settings, especially in Catholic schools and other religious schools where they use the money not just for abstinence only, but also health education. It's a valuable program. We have limited dollars, and I just don't want to see a whole other program put in here to take more money away from that small program called abstinence only, which is underfunded 12-1 to comprehensive sex education programs.
Mr. Chairman? Gentleman, yield to me.
Sure, Mr. Chairman.
Well, it seems to me that a lot of these abstinence-only programs were not successful because they were more ideological than trying to give honest information to teenagers. And I think that there's nothing wrong with an abstinence-only program, but they ought to be honest about how they are delivering their message. This program that's being proposed is grants to the states to go to schools or other places for educational purposes on how to reduce teen sexuality, and they want to make sure that it's tested to be based on evidence. A lot of those abstinence-only programs not only gave misinformation, but they didn't succeed in accomplishing their goals.
Yeah.
Now,
Well,
if it's an abstinence-only program that succeeds and is directed at the science and the morality, it should be judged on whether it accomplishes the goal of reducing teenage pregnancy and sexually transmitted diseases. And if it doesn't, because some of them did not, when, well, I didn't realize the time has passed.
Move to strike the
Well,
light.
okay, can I just respond?
Without objection, you'll be given an additional
Sure.
minute.
For the record, if you like, I'll give you 9 different studies. The latest 2005 by Centers for Disease Control conclusion, fewer teens are having sex, which means more teens are choosing abstinence. Actually, you go back to the Journal of Adolescent Health, 2004. Abstinence has substantially contributed to the decrease in teen pregnancy. You can go to the American Journal of Health Behavior. Abstinence education reduces sexual initiation over a 12-month period. Go to the Journal of Health Communications. It says abstinence education demonstrates statistically significant, consistent changes on measures of program awareness, beliefs, attitudes, self-reported behaviors, and pregnancy rates.
Gentlemen, yield. If you're right, then, as I understand it, they'd be eligible for grants under this program. but I want to be sure that they're living up to.
My concern is-
that they succeed.
Yeah, my concern is the president's budget proposal and the labor HHS appropriations we're about due this week does away with the money for abstinence only. And these aren't reports I wrote, these are other reports. And now we're adding another
would be-
program, so it's easier to fund a program authorized as opposed to one that the president may not agree with. So therefore, I would reluctantly
Move to strike the last.
I move to strike the
vote
last
against the
Instead of
amendment.
seeking recognition. Mr. Boyer.
Thank you, Mr. Chairman. I want to compliment you for bringing the amendment. I am pro-life. Whenever I see amendments like this, immediately I get concerned about how much money may be directed to Planned Parenthood. I'm just being honest, I do. I am also pragmatic. So while I'm an individual who is pro-life and pragmatic, that means in the past I have voted that teenagers could gain access to condoms, for example, without parental notification. I have voted for that. Now, why do I talk about this in this debate? We have a pandemic facing our country. Over 70 million Americans have had a sexually transmitted disease. 70 million Americans. Now, think about that. So let's stop trying to kid ourselves here. I believe parents should be giving that education to their children. Are parents doing their job? Are they acting responsibly? The answer is they must not be. There's a real problem out there. Now, go to this issue that the chairman brought up about moralistic approach versus ideological approach. Mr. Chairman, that is exactly what I brought up when we did the tobacco legislation. I said you're doing abstinence, we're not being pragmatic without a harm reduction strategy. And that's exactly now what we're talking about here. Mr. Stupak is arguing for abstinence, and Ms. Capps, you're arguing for education, an education on about a harm reduction strategy that can help better our society. So the reality is we both have to come together. Those of whom promote abstinence also must embrace risk management, about healthy choices, harm reduction strategies, and it's coupled through education. But Ms. Capps, you should be a very good listener here to Dr. Murphy, who has genuine concerns, though, about who should be teaching that. Should they be licensed? What are the qualifications for that? So please just don't say, well, we'll just leave that up to the states. I think what I would ask you, Ms. Capps, is to work with Dr. Murphy here. Work with myself. I don't object to what you're doing here, because we better face this fact about 70 million Americans having sexually transmitted diseases. And see, Mr. Chairman, when I get you to have buy-in to couple abstinence with a harm reduction strategy and education with regard to how we approach this type of behavior, I will win your support on a harm reduction strategy with tobacco when I bring that legislation. Because we can't be one way on one thing in some way and take a different approach. And you and I have had that discussion. You're the one that used the word pragmatic to me when you said, Steve, we do have to do both. We have to couple them. So I just want to share, everyone, that's where I am in this question. So I like this amendment, but I think it needs a little more perfecting, Ms. Capps. And I'm hopeful that you're going to be a good listener. I want to yield to Dr. Murphy, because he has some concerns here. And then Dr. Murphy, share a little bit of time to give to ranking member.
Thank you. I thank the gentleman. I just want to add a little bit more to what I was saying before about I'm concerned about defining who would be doing this. When someone is licensed or certified, whether they're a teacher or a nurse, whoever, at least there's some professional status that they have. They have professional ethics. They have continuing education requirements. And in this, and I've read this again, I still don't see anything here that specifically says if someone fails to achieve these results, they're not eligible for further grants. I'm very concerned that we all share a passion for reducing these problems. They are serious problems in our society. And I have dealt with more than my share of children born to single parents or have serious problems or a whole host of things. But I want to make sure that we are using the very criterion we're demanding here, and that's evidence-based medicine, and saying if the evidence isn't there, state, from what you do, then your organizations under this aren't going to get some money. Let's make them, let's define that they have to think in those terms of some evidence and put people there. We've seen enough problems with people in every profession out there who get involved in these things, maybe give misinformation. So I hope we will still consider that as some professional criteria and some requirements of results. And I yield to the chairman.
Time and yield to the ranking member.
I think I have the perfect antidote, Mr. Chairman, to teenage pregnancy. Require every teenager to sit through one of these markups. If that doesn't put you in a non-sexual, non-interactive mood, nothing will. But I didn't think it's that funny, but
I'll yield back my time.
anyway, I
Chairman.
I have my substantive point, Mr. Chairman. No, the gentlelady from California.
Without objection, gentlemen, be given an additional minute.
The gentlelady has already passed one amendment to the pending bill that adds over $500 million in spending over 5 years, at least authorization level. If we pass this one too, this one is $50 million a year for 5 years, which is another $250 million. That's $750 million with no offset, no cost saving requirement, and I think that's a little bit much. I would oppose it on the physically sound policy, not just some of the substantive issues that have been raised. And with that, I thank the chair for yielding additional time.
Mr. Chairman,
Ms. DeGette,
I move to strike the last word.
gentlelady is recognized.
I just want to clear up a couple of things that have been said. First of all, we've had abstinence-only sex education around since 1981, when Congress first passed the Adolescent Family Life Act. And then, as Mr. Stupak said, in 1996, we approved Title V, and that also is a block grant program that continues to this day. But I found it fascinating that some of my friends on the other side were very, very concerned about what kind of evaluation techniques Ms. Capps was going to use in her amendment, because in fact virtually every study shows that abstinence only does not work. And I have a great deal of love and affection for my friend Mr. Stupak, but those studies he's talking about, I don't think they're abstinence only. Congress, because of this ongoing debate that we've had for so many years, Congress actually asked for a study, and we commissioned this study from Mathematica, Inc. The study came out in April 2007, and what they found was that teenagers who participated in abstinence-only sex education programs had just as many sexual partners as teenagers who had not participated in the program, and that abstinence-only kids were no more likely to abstain from sex than other kids. Now, there was a Texas A&M study, and I'm kind of loath to say that sitting next to my buddy, Mr. Green.
I'm not the Aggie, our ranking member is the Aggie.
Okay, our Mr. Ranking Member, this Texas A&M evaluation of 5 abstinence-only programs being taught in Texas schools reported that students in virtually all high schools were more sexually active after taking the course. And I will also note that under Title V, let me just finish. Under Title V, the criteria that they set forward, if you look at Section 510 of Title V, the criteria are admirable goals, most of them, and ones that I would want to teach my children, but they're not science-based. And that's why abstinence-only sex education, when taught as part of a high school curriculum or school curriculum, is not very effective. So this is why I've been a big proponent, many of us have been proponents for years, of abstinence-based or science-based sex education, because it will work. And that's why Ms. Capps is saying that abstinence only could be allowed under her amendment if it was proven to be scientifically effective. But I will also note, and I've looked at a lot of the curriculums of these abstinence-only programs, some of them are based in religion, which is fine if you're teaching that in a religious school, but they're not appropriate with federal funds. Some of them are sort of based in folklore and fairy tales, and we really, if we're really going to teach our kids to refrain from sex, And believe you me, I have 2 teenage daughters. I teach abstinence over at my house every day, but we have to do it in a science-based way. And with that, I'll yield the remainder of my time to Ms. Capps.
And I won't take the entire time. I just want to go back to what this amendment does. It is limited in scope, with all due respect to who's teaching it, the class, or the content of the class. That is not the subject. But to this point, we have never established a grant program, and I did use the word program, that's based on evidence, that where the criteria is, does it work? That is all the CDC seeks to establish, and it is up to the states to apply for the funding and then to implement it with the kind of content and the kind of quality of the teachers that they wish to impose upon it. And with that,
I'll yield briefly to the gentleman from Texas.
Thank you, Mr. Chairman. I just want to respond to our ranking member, my good friend. The authorization levels that are in this amendment and the earlier CAPS amendment are really authorization levels. So, we don't know what the Appropriations Committee may fund. But in 2007, there was only $176 million. Well, I take that back. Funding abstinent-only programs at the astonishing level of $60 million. So I don't even know if our Appropriations Committee would increase it that much. But I agree with the amendment that we need to have evidence-based, no matter whether it's abstinence or any other program. It should be evidence-based. And I thank my colleague for yielding.
I'll yield to the chairman.
I'm going to support your amendment, but I think Mr. Murphy raises some good points, and I'd like to request that Ms. Capps, should her amendment be adopted, continue to talk to Mr. Murphy and others to pin down some of those issues that he has raised, to be sure that we have competent people administering the programs, and perhaps even to talk to Mr. Boyer about making sure that this is a pragmatic approach. We want to stop this epidemic of teenage sex and unplanned pregnancies and sexually transmitted diseases.
Mr. Chairman, I ask unanimous consent Ms. Capps be granted an additional minute.
Without objection. It's not her time, though.
Mr. Chairman, I asked to
Oh, it's not.
speak.
Oh, I'm sorry. To get an additional minute. I
Without
ask unanimous consent from
without
Ms.
objection.
to grant an additional minute.
Without
the
objection.
gentlelady yield.
I'll yield.
Thank you. I'd like to ask you a question, Ms. Capps.
Yes.
How do we do scientific? How do we do in abstinence education? You will permit it if it's scientifically based. How do we?
I didn't say scientifically based. I said evidence-based.
Okay. How do
Does
we
it work?
How do we do evidence-based for abstinence? How do we do that?
The Centers for Disease Control can do that.
Reclaiming my time, there are whole curriculums, and Mr. Boyer, I'd be happy to get you that information, how
All right,
they
I'll
do that.
I'll be more than happy
Because
to.
there are whole curriculums.
I just want to, Ms. Capps, if we can achieve exactly what the chairman's doing here, if we can couple and move toward pragmatism where we can actually do abstinence with your goals to attack the pandemic that we have, I'll embrace your amendment. I will.
But it's not limited to
please-
abstinence.
And reclaiming my time, that's why we say abstinence can be part of this. And I'll yield back.
And I'm happy to work with anyone in terms of implementation of this amendment.
Mr.
After
Barton.
it's passed.
Mr. Chairman,
Should it
I
pass?
want to speak, strike the requisite number of words.
Gentleman's recognized.
Ms. Congresswoman DeGette made an incorrect statement in her time when she said that abstinence education had been around since the 1980s. Every girl I dated in high school practiced it. And it was very effective because when I went to pick them up, their father reinforced it on me. So it does work. It does work, and it has been around much longer than the 1980s.
Maybe on a case-by-case basis, Mr. Barton.
That I yield back.
Would the gentleman yield?
Yield to my friend from Louisiana.
I want to thank the ranking member. And getting back to the authorization, this is a $250 million authorization. And while the title talks about preventing teen pregnancy, if you actually read the language on page 2, lines 3 and 4, the two goals are to reduce teen pregnancy or sexually transmitted diseases. not and sexually transmitted diseases, or. And then when you go to the actual evidence-based definition, we've been hearing all this about evidence-based as if we're talking about proof that you're reducing teen pregnancy. The term evidence-based definition, the definition means based on a model that has been found in methodologically sound research, and go to number 5, to improve rates of contraceptive use. So the bar is set so low on this, we're talking $250 million of taxpayer money that's being authorized as all this conversation about lowering the cost curve, bending the cost curve down. This bends the cost curve up $250 million more dollars, and it allows a group like Planned Parenthood in a state that doesn't have a prohibition without a child's consent. It would allow a group like Planned Parenthood to just get this money and go in and prove that they improved rates of contraceptive use. Teen pregnancy could actually go up.
Would the gentleman yield?
Let me finish the thought. Teen pregnancy could actually increase, and according to the language on page 2, as long as they controlled sexually transmitted diseases, they could get the money as long as they proved that young teenage girls had an improved rate of contraceptive use. And they could qualify and meet all the goals for this money, $50 million a year. I think this is...
Mr. Scalise, would you yield?
I'd be happy to.
Mr. Scalise?
The ranking member's got the time, so I'll yield back to him, and if he wants to yield.
Gentleman, yield.
I would yield to the ranking member.
Mr. Booyer.
The challenge that we have is that not all sexually transmitted diseases can be prevented with condoms. So you've got some sexually transmitted diseases that are best controlled through abstinence. And we're back to now the chairman's, I'll embrace the chairman's word about pragmatism. You have to do both. And I'll throw it right back to you, Ms. Capps. I want you to please work with Dr. Murphy and myself or any other member that may have
Happy to do it.
concerns, and maybe we can work this out in a manner that you get comfort with Mr. Stupak and myself that we actually can couple the two to attack the pandemic. With that, I'll yield back to the gentleman.
And I yield back, Mr. Chairman.
Are we ready for the question? Mr. Cherry.
Move to strike the last word.
Gentleman's recognized.
Thank you. Question for council, if you can help me out. The current sex education programs are not evidence-based. What are those programs?
To my knowledge, sir, there are 2 programs on abstinence only, one contained within...
No, I said sex education, not abstinence only.
To my knowledge, there are no purely sex education programs within the jurisdiction of the Energy and Commerce.
That wasn't my question, but I think that was your answer.
If there are programs authorized in the Education and Labor Committee or the Ways and Means Committee, I'm sorry, I don't know.
So the Adolescence and Family Act, Title 20 is not part of this, or the abstinence is not
The
part of the
Adolescent
program?
Family Life Program, which is Title 20 of the Public Health Service Act, is an abstinence-only program.
Okay. So the sex education ones don't have any jurisdiction here. It's just when you don't have sex, this committee has jurisdiction.
As part of a number of other programs, one component of the provision of health care services may be sex education. It is included in the sex education may be included, for instance, in the maternal and child health program. It may be included in the Title X family planning program. It may be included in the Ryan White health care services program. There are a number of programs in which sex education is discussed. But as a primary purpose for a grant program, there are no programs in this that I know of in this committee's jurisdiction that are not abstinence-only sex education programs.
Okay.
Are we ready for the vote? All those in favor of the Capps amendment will say aye. Aye. Opposed, no. The ayes have it. The amendment's agreed to.
Mr. Chairman, I'd like a roll call vote.
Clerk will call the roll.
Mr. Waxman.
Aye.
Mr. Waxman votes aye. Mr. Dingle. Mr. Dingle votes aye. Mr. Markey. Mr. Boucher. Mr. Pallone. Mr. Pallone, aye. Mr. Gordon. Mr. Rush. Ms. Eshoo. Ms. Eschy votes aye. Mr. Stupak? Mr. Stupak, no. Mr. Engel? Mr. Engel, aye. Mr. Green? Mr. Green, aye. Ms. DeGette? Ms. DeGette votes aye. Mrs. Capps? Mrs. Capps, aye. Mr. Doyle? Mr. Doyle, aye. Ms. Harmon? Ms. Harmon votes aye. Ms. Schakowsky? Ms. Schakowsky, aye. Mr. Gonzalez? Mr. Gonzalez, aye. Mr. Inslee? Mr. Inslee, aye. Ms. Baldwin? Ms. Baldwin, aye. Mr. Ross? Mr. Weiner? Mr. Weiner, aye. Mr. Matheson? Mr. Butterfield? Mr. Butterfield, aye. Mr. Melanson? Mr. Melanson, no. Mr. Barrow? Mr. Barrow votes aye. Mr. Hill? Mr. Hill votes aye. Ms. Matsui? Ms. Matsui, aye. Mrs. Christensen? Mrs. Christensen, aye. Ms. Castor? Ms. Castor, aye. Mr. Sarbanes? Mr. Sarbanes, aye. Mr. Murphy of Connecticut? Mr. Murphy, aye. Mr. Space? Mr. Space, aye. Mr. McNerney? Mr. McNerney, aye. Ms. Sutton? Ms. Sutton votes aye. Mr. Braley? Mr. Welch? Mr. Barton? Mr. Barton, no. Mr. Hall? Mr. Hall votes aye. Mr. Upton? Mr. Stearns? Mr. Stearns, no. Mr. Deal? Mr. Deal votes no. Mr. Whitfield? Mr. Whitfield, no. Mr. Shimkus? Mr. Shimkus, no. Mr. Shattuck? Mr. Shattuck, no. Mr. Blunt? Mr. Blunt, no. Mr. Boyer? Mr. Boyer, aye. Mr. Radonovich? Mr. Radonovich, no. Mr. Pitts? Mr. Pitts votes no. Ms. Bono Mack? Ms. Bono Mack, no. Mr. Walden? Mr. Walden, no. Mr. Terry? Mr. Terry votes no. Mr. Rogers? Mr. Rogers, no. Mrs. Myrick? Mrs. Myrick, no. Mr. Sullivan? Mr. Sullivan, no. Mr. Murphy of Pennsylvania? Mr. Murphy, no. Mr. Burgess? Mr. Burgess, no. Ms. Blackburn? Ms. Blackburn, no. Mr. Gingrey? Mr. Gingrey, no. Mr. Scalise? Mr. Scalise, no.
Other members wish to be recorded?
Mr. Braley is not votes, I'm sorry. Mr. Braley votes aye. Yeah.
Mr. Markey?
Mr. Boucher?
No, you'll call him.
Mr. Boucher? Mr. Boucher votes aye. Mr. Markey? Mr. Markey, aye. Mr. Matheson? Mr. Matheson, aye. Mr. Ross? Mr. Ross, no. Mr. Welch? Mr. Welch votes aye.
Have all members responded to the call of the roll? Clerk will tally the vote. Clerk will announce the vote.
Mr. Chairman, on that vote, there were 33 ayes and 23 noes.
33 ayes, 23 noes. The ayes have it, and the amendment's agreed to. Mr. Terry, you have an amendment at the desk. Clerk will report the Terry amendment.
Terry, 1.
Scott here, you want to reopen the vote? Let him vote. I'm willing to do that if you want to.
Amendment offered by Mr. Terry of Nebraska. Strike section 17.
Without objection, the amendment will be considered as read, and the gentleman from Nebraska is recognized for 5 minutes.
Thank you, Mr. Chairman. And this is a rather simple amendment. It reauthorizes TNA with the abstinence education Title V that is set to expire. It needs to be reauthorized, and so this reauthorizes that section from 2010 through 2012. And we've participated, engaged in a discussion on abstinence-only education, of which Title V is abstinence education, and this has been well established since 1996. It had several years where it was fledgling, a variety of different curriculum. And I would like to discuss some of the, or participate, or extend on some of the discussion that we had prior. I actually believe many of the reports that I have read and studies that I have read that abstinence-only education, when done in its more mature way that's been done for the last several years, is an effective tool. Abstinence education, as it has evolved, is a more holistic, health-based program that starts with the first premise of abstinence and keeps that theme throughout as it discusses in a holistic way the health of the person, all the way from its the person's mental health, what defines healthy relationships, as part of healthy relationships, learning how to say no, boosting self-esteem. And when we get to the area of the sex education part, condoms, they use evidence-based. And so I feel that it's been effective. Now, there was a government study requested by Henry Waxman, guided, I believe, by participants of his staff, and it did conclude, as Ms. DeGette, my friend from Colorado, stated, that it made a conclusion that abstinence-only programs under Title V have been ineffective. But as I looked through that, what I saw is that they were looking at some of the curriculum that was used by a couple of organizations when they first started out. And so I believe that study did not reflect the current state of abstinence-only education. So I stand or sit here today and ask that we simply extend Title V TMA for 2010, 2011 through 2012. One last thing that I want to bring up just anecdotally in my district. I'm not proud of the fact that Douglas County, my home, has one of the top 3 sexually transmitted disease ratios to young people. I'm thoroughly embarrassed by that. Our Douglas County Health Department has done a good job. All of their efforts are traditional sex education, give out condoms, and not like the abstinence-only programs. Omaha Public Schools is not an abstinence-only. In fact, none of our public schools is an abstinence-only except for one, Boys Town. Amazingly, Boys Town is full of at-risk youth, but yet the criteria, anecdotally, of those folks, those young people that are placed mostly by courts in Boys Town have a lower rate than their peers of sexually transmitted diseases because they are taught abstinence only. So if The last vote incorporated abstinence only. Let's do the right thing and reauthorize and extend TMA, TNA, and Title V. I yield back my time.
Mr. Chairman.
Would the gentleman yield?
My last 9 seconds, I yield.
I support the Terry amendment. I hope we don't have a long debate on it. We just spent about 40 minutes on abstinence in the CAPS amendment, so it's pretty well known and people's positions are probably pretty well defined. But this is straight reauthorization of a program that expired last month, and hopefully we could support it and move on.
Mr. Chairman.
Gentleman's time has expired. Mr. Gett.
Seek recognition in opposition to the amendment.
Gentlelady is recognized.
I'll be very, very brief because we did just debate this for 40 minutes. But in 2007, between the two abstinence-only programs, we were spending over $200 million. And there's been a lot of concern expressed tonight for the fiscal responsibility that we're showing in this legislation. And for whether or not the programs, there was extensive grilling of Ms. Capps on her amendment about evaluation and outcomes. And I really do think that we should hold every federal program to that standard. In truth, the Mathematica study was only released 2 years ago, and it did take all of these programs into account. And yet sexual activity among teenagers was no different if they had abstinence only or abstinence and science-based programs, as Ms. Capps' amendment is encouraging. And Mr. Chairman, that's why 23 states have rejected this Title V money, because they realize that it just doesn't work. So I would suggest, if we're concerned about the things Mr. Boyer is saying and many, many other people about not only preventing teen pregnancy, but also sexually transmitted diseases, we should defeat this amendment because it's a waste of money, it's a waste of a program, and we should put our efforts where it's going to work into saving our young people. With that, I'll yield back.
Mr. Chairman.
Mr. Chairman.
I'll yield to the gentlelady from Wisconsin.
Thank you for yielding, and I don't want to prolong the debate too long either, but I didn't weigh in the last round, so I do want to share a couple of thoughts. I mean, first of all, the encouragement of abstinence is an important message, but it should never be the only message. The lives and well-being and health of our young people are just too important. I am familiar with a number of peer-reviewed studies that have found these abstinence only until marriage to be broadly ineffective. And we've been talking a little bit about the Mathematica policy research study that was reported in 2007, but in addition to that, there's been studies and reports from 13 states that have evaluated their own Title V abstinence-only programs. There has been a report in early November 2007 from the National Campaign to Prevent Teen and Unplanned Pregnancy, releasing a report called Emerging Answers, which discussed what programs work in preventing teenage pregnancy and STDs, including HIV. And that report found strong evidence that abstinence-only programs do not have any impact on teen sexual behavior. The study found no evidence to support the continued investment of public support or public funds, and I quote from that report, "In sum, studies of abstinence programs have not produced sufficient evidence to justify their widespread dissemination. Only when strong evidence demonstrates that particular programs are effective should they be disseminated more widely." The study also found that to date no abstinence only until marriage program that is of the type to be eligible for funding from the federal government had been found in a methodologically rigorous study to positively impact teen sexual behavior. And I quote from that aspect of the study, "At present, there does not exist any strong evidence that any abstinence program delays the initiation of sex, hastens the return to abstinence, or reduces the number of partners. In addition, there is strong evidence from multiple randomized trials demonstrating that some abstinence programs chosen for evaluation because they were believed to be promising actually had no impact on teen sexual behavior." There's another study came out in mid-July, published by the British Medical Journal, that actually looked at abstinence-only curricula in multiple nations, but again, it was a very dim view in terms of their effectiveness. And lastly, the Institute of Medicine has called for the termination of abstinence-only programs because they represent, and I quote, poor fiscal and public health policy, and leading public health and medical professional organizations, including the American Medical Association, the American Academy of Pediatrics, the Society of Adolescent Medicine, and the American Psychological Association, have raised serious ethical concerns about U.S. support for such programs. These organizations and many others do not support abstinent only until marriage programs, but instead support a comprehensive approach to educating young people about the consequence of their behaviors, very much the type of programs that were embodied in the amendment that we just considered. And with that, I would yield back.
Mr. Chairman, I move to strike the last word.
Yes, Mr. Boyer.
I agree with the ranking member. I thought this was pretty well settled in the last discussion on the Ms. Capps amendment. And Ms. Capps, I voted for your amendment. I'm quite certain it will upset some of my constituents that I've done that. But I've done that because I want a pragmatic approach to a pandemic in our society. So for those of whom are arguing that the abstinence only is not the correct approach, I just want you to know I don't believe that. I believe in a pragmatic approach which couples a harm reduction strategy with abstinence. So when you do that, please don't argue against what Mr. Terry is trying to do. We should be doing both. You should be supporting the goals of Mr. Stupak and Mr. Terry and those of us that are here, and Ms. Capps, your willingness to work with myself and Dr. Murphy to make sure that we've got a level of comfort with regard to who is doing the education and teaching. But I'm going to call out one of the OBGYNs that sit on this committee. Because to Mr. Scalise, I put that warning out to him that there are forms of sexually transmitted diseases that you're not protected against if you were to use a condom. So, Dr. Burgess, I'm going to call you out. I'm going to call you out and I'm going to yield to you because bring some clarity to our debate here, because there are sexually transmitted diseases that if in fact you say, okay, let's go ahead and use a condom, you're still going to have trouble unless you take an abstinence until marriage approach. Dr. Burgess, I'm going to yield to you. Call you out.
Thank you, Mr. Boyer. I appreciate the recognition, your willingness to yield to me. I had hoped to remain relatively quiet during this debate. But hearing Mr. Representative Terry's, the pain in his voice about the amount of sexually transmitted disease in some of his communities, and it really, I take him at his word. I do believe that was pain that we were hearing from Representative Terry. And Mr. Boyer alluded to a very startlingly high number of sexually transmitted diseases. Now, we came through in the last century the scourge of 2 sexually transmitted diseases that ultimately were cured by antibiotics, and everyone thought, well, those days are now long past. But there are other diseases that were out there the whole time and only more recently have received our recognition and our cognizance. And 2 of those illnesses are viral illnesses. And the use of any type of barrier or spermicidal contraception will provide no protection. And in fact, they may even be more dangerous because they provide the illusion of protection when in fact no protection exists at all. And I just recall in my own experience at my little hospital, we had another very popular Democratic president, Bill Clinton, and his Surgeon General really promoted the use of condoms. And I will never forget the explosion of herpes simplex virus we had in one of our high schools shortly after those commercials hit the public service announcements on the airwaves. They do not protect against the herpes simplex virus. That's a skin-to-skin transmission, and the skin involved may not be covered by a condom. They do not protect against human papillomavirus, and although there's some promise from a new vaccine that was recently introduced, there is no evidence that barrier and spermicidal methods will protect against human papillomavirus, which may lead in susceptible individuals with the right type of viral strain, may lead to cancer of the cervix in vulnerable individuals in the future. So these are terribly important issues, and they really shouldn't be so casually dismissed here at 11 o'clock at night. This does require some significant thought. I support Mr. Terry's efforts. I think he's to be applauded for taking what he knew might be an unpopular stand in this committee, and I intend to vote for his amendment when it comes to a vote. I'll thank Mr. Boyer for the time, and I'll yield back to Mr. Boyer.
Thank you. I reclaim my time. So, Ms. Capps, this is exactly, let me go back to, I'll be circuitous now. This is exactly why I supported your amendment, so that we can couple both. Your goals to make sure that the education is out there, that these individuals make informed judgments about their own bodies. If they want to take risky behaviors, there are consequences from that, not only to you, but perhaps to others on down the line in the future. And when we couple the education along with abstinence, we can go after this pandemic that we have in our society. So what I'm hopeful here is that we can combine our efforts, your amendment along with Mr. Terry's, and I think it would be good for our country. With that, I yield back.
The gentleman yields his time back. A chair recognizes himself. I want to suggest, Mr. Boyer, that we be pragmatic. In the adoption of the CAPS amendment, abstinence-only programs at work can qualify for funds. But this Title V abstinence-only program has been a failure. It's gone through a randomized controlled study, and it had no impact on whether teens had sex compared to the control group, no impact on the age of first sex, no impact on the number of partners, no impact on rates of pregnancy or sexually transmitted diseases. So when it was measured, it came up short. It failed. And in fact, so many states, 25 states, decided not even to accept funds because they just didn't think it was worth it to take government funds from the federal government and then be so restricted that they could only say that they would have an abstinence-only program based on a curricula that didn't work. Medical organizations agree that this program hasn't had the right approach. The Institute of Medicine recommended we eliminate the abstinence-only requirements. The American Medical Association, which also supports our bill, by the way, opposed the sole use of abstinence-only education as defined under Section 510. And so I think we ought to stick with this Healthy Teen Initiative. We've adopted it. Let the states do programs based not on ideology, but on pragmatism. What works? And abstinence-only programs and other models would be eligible if they are scientifically shown to reduce teen pregnancy or sexually transmitted disease.
Mr. Chairman, would you yield to me?
I'd be happy to yield to Ms. Harman.
Yeah, I have not spoken during this debate, but like most others here, I feel intensely on this subject. And most of us are parents, and we had to think carefully about what to counsel our own children. I would just suggest that based on what Mr. Boyer said, and I've been listening carefully to what he has had to say in this debate, and I commend him for his vote on the CAPS amendment, and Dr. Burgess, I don't think any of us should support a condom-only program either. I think what makes sense is to let the CAPS language work and then support what the evidence tells us to support, including abstinence programs if the evidence tells us that they work. And so I would urge a no vote on this amendment, and thank you for yielding to me.
Let me just point out that we all agree that programs should emphasize abstinence. No one's disagreeing with that. But if you only talk about abstinence and don't educate teenagers about the fact that they ought to be knowledgeable about public health information, and that condoms do work most of the time, and if they're going to be sexually active, and we would discourage it, but if they are going to be sexually active, there are some steps they could take to minimize the risk. Again, the point that Mr. Boyer made, look for risk reductions. That's at least an honest approach, but emphasize abstinence, but don't make that the only requirement. Who else?
Will the gentleman yield?
Mr. Chairman.
Who wants me to yield? Mr. Pitts.
Thank you, Mr. Chairman. I haven't weighed in on this. I'd like to support the Terry amendment. The abstinence, Title V abstinence education
and temporary medical education programs expired on June 30, 2009. And I have copies of these studies. There's been some misstatements made here. I'd just like to correct a couple of them. The Mathematica study evaluated only 4 out of over 700 Title V abstinence education programs. And the programs they selected were some of the earliest programs developed, as Mr. Terry said. Abstinence education programs have evolved significantly since 1999 when the study began. And it studied students only in elementary and middle school without any reinforcement in high school. Far from just say no approach, the skills taught include the following: building healthy relationships, goal setting, effective decision making, self-efficacy skills, medically accurate information on contraception, and full information on STDs. And I could go on and on, but just let me say that in 2006, a Zogby poll demonstrated that parents prefer abstinence education. An overwhelming 78% of parents believe that sex education classes should emphasize abstinence. Sexual activity among teens has physical, emotional, social consequences. In fact, sexually active females are 3 times more likely, and males are 8 times more likely to attempt suicide. Rates of depression are 3 times lower in abstinent girls and 2 times lower in abstinent boys. Further, risky sexual behavior often leads to other risky behavior among teens, such as alcohol and drug use. I think abstinence education is important. It's an important form of health risk avoidance education. I think it provides teens with accurate and appropriate information about the risk of sexually transmitted diseases and pregnancies, teach them how to avoid risky behavior. I think we should all support this amendment because we all support our youth, and I think we support equipping them to make positive life choices. So I urge support for the Terry Amendment. I think it's critical, and I thank you and yield back.
Gentleman yields back. Are we ready for the vote?
Mr. Chairman.
Who's seeking?
Mr. Chairman,
recognition?
over here.
Yes.
Move to strike the last
Gingrich.
word. Mr. Chairman, Mr. Booyer didn't give me a shout out in regard to OBGYN's opinion, but I want to express my opinion on this important issue and to support, very strongly support, the Terry Amendment. I think what Mr. Pitts just said is so darn important. You know, you gave us the results of a study. Mr. Chairman, you said that the study showed that abstinence only is ineffective, age of first sexual activity, number of sexual partners. But, you know, again, that was based on some early programs, some very early programs that did not have follow-up from middle school to high school. And what Mr. Pitts is saying, rates of suicide, success of marriage, mental and emotional status as an adult, the opinion of the parents in a Zogby poll. I mean, you know, you can quote all these scientific studies you want to, and statistics can say whatever you want them to say, but when you ask parents if telling their children to avoid sexual activity until marriage, maybe they don't, but I just can't help but intuitively feel that the age of first sexual activity, the number of sexual partners, certainly sexually transmitted diseases, all would be reduced. So I think it's a common sense amendment. I don't say that a comprehensive approach is not important. It is important. But this Title V funding is very, very necessary, and I want us to continue it, and I fully support the Terry Amendment, and I yield back.
Let's go for the vote now on the Terry Amendment. All those in favor of the Terry Amendment will say aye. Aye. Opposed, no. No. Well, let's go to a roll call vote.
Mr. Waxman?
No.
Mr. Waxman, no. Mr. Dingle? Mr. Dingle votes no. Mr. Markey? Mr. Boucher? Mr. Pallone? Mr. Pallone, no. Mr. Gordon? Mr. Rush. Ms. Eshu. Ms. Eshu, no. Mr. Stupak. Mr. Stupak, aye. Mr. Engel. Mr. Engel, no. Mr. Green. Mr. Green, no. Ms. DeGette. Ms. DeGette, no. Mrs. Capps. Mrs. Capps, no. Mr. Doyle. Mr. Doyle, no. Ms. Harmon. Ms. Harmon, no. Ms. Schakowsky. Ms. Schakowsky, no. Mr. Gonzalez. Mr. Gonzalez, no. Mr. Inslee. Mr. Inslee, no. Ms. Baldwin. Ms. Baldwin, no. Mr. Ross. Mr. Weiner. Mr. Weiner, no. Mr. Matheson. Mr. Matheson, no. Mr. Butterfield. Mr. Butterfield, no. Mr. Melanson. Mr. Melanson, aye. Mr. Barrow. Mr. Barrow, aye. Mr. Hill. Ms. Matsui. Ms. Matsui, no. Mrs. Christensen. Mrs. Christensen, no. Ms. Castor. Ms. Castor, no. Mr. Sarbanes. Mr. Sarbanes, no. Mr. Murphy of Connecticut. Mr. Murphy, no. Mr. Space. Mr. Space, no. Mr. McNerney. Mr. McNerney, no. Ms. Sutton. Ms. Sutton, no. Mr. Braley. Mr. Welch. Mr. Welch, no. Mr. Barton. Mr. Barton, aye. Mr. Hall. Mr. Hall, aye. Mr. Upton. Mr. Upton, aye. Mr. Stearns. Mr. Stearns, aye. Mr. Deal. Mr. Deal, aye. Mr. Whitfield. Mr. Whitfield, aye. Mr. Shimkus. Mr. Shimkus, aye. Mr. Shattuck. Mr. Shattuck, aye. Mr. Blunt. Mr. Blunt, aye. Mr. Boyer. Mr. Chairman. She's voted no. Mr. Boyer, aye. Mr. Odanovich. Mr. Odanovich, aye. Mr. Pitts. Mr. Pitts, aye. Ms. Bono Mack. Ms. Bono Mack, aye. Mr. Walden. Mr. Walden, aye. Mr. Terry. Mr. Terry, aye. Mr. Rogers. Mr. Rogers, aye. Mrs. Myrick. Mr. Myrick, Mrs. Myrick, aye. Mr. Sullivan. Mr. Sullivan, aye. Mr. Murphy of Pennsylvania. Mr. Murphy, aye. Mr. Burgess. Mr. Burgess, aye. Ms. Blackburn. Ms. Blackburn, aye. Mr. Gingrey. Mr. Gingrey, aye. Mr. Scalise. Mr. Scalise, aye. Mr. Markey. Mr. Markey, no. Mr. Boucher. Mr. Boucher votes no. Mr. Ross. Mr. Ross votes no.
Have all members responded to the vote? I know there's some members on the way. Well, any member wish to change your vote? If not, the clerk will tally the vote and announce it.
Mr. Chairman, on that vote, there were 26 ayes and 29 noes.
26 ayes, 29 noes. The amendment is not agreed to. Mr. Pallone.
Could the ranking member inquire how much longer we intend to have this fund tonight?
I think we're close to finishing on this title, so let's see if we can do it.
Well, I know of,
You have 2 amendments, I think, or maybe
well, just, we have lots of amendments, but
to this title.
to this title. We had 2 that we were going to offer tonight, but we have half a dozen that we could offer, and I'm aware of 10 on your side that could be offered.
I don't know if that's that many.
I was told there were. They were going to be offered and withdrawn and various things.
There's some amendments that are going to be offered and withdrawn. Let's just keep going for a while, and then we'll see if we can finish. If not, we'll have to come back tomorrow and finish this title. Mr. Pallone, do you have an amendment at the desk? The clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 3200 offered by Mr. Pallone.
Without objection, the amendment will be considered as read and circulated. And Mr. Pallone, you're recognized for 5 minutes.
Thank you, Mr. Chairman. This is the Class Act. While approximately 46 million Americans do not have medical insurance, over 200 million adult Americans lack any insurance protection against the cost of long-term services and supports, and as a result, nearly half of all funding for these services is now provided through Medicaid, which is a growing burden on states and requires individuals to become and remain poor to receive the help they need. In order to address this growing concern, earlier this year, Mr. Dingell and I introduced H.R. 728, the Community Living Assistance Services and Supports, or CLASS Act. It's the companion bill to legislation offered by Senator Kennedy. Similar to the CLASS Act, this amendment would direct the Secretary of Health and Human Services to establish a new voluntary nationwide insurance program so that people with disabilities and chronic illnesses will have a cash benefit to pay for and choose the services and supports they need to stay financially, functionally and independent in their communities. The new program would be financed through new voluntary payroll deductions and not through new federal dollars. Now, I know some of my colleagues have concerns about the impact that this program could have on the budget deficit in the long term, and I'm very cognizant of those concerns, and we drafted this amendment with those concerns in mind. So we include language in the amendment directing the Secretary to take any other action appropriate to develop, manage, and maintain the Class Independence Benefit Plan, including making adjustments to the benefits paid out and premiums collected in order to maintain program solvency and ensure the program remains deficit neutral. The Secretary will have the tools she or he needs to make sure this program does not grow into a new entitlement and add to our nation's economic woes. If anything, this program helps alleviate some of those problems. As CBO noted in its analysis of the Senate help version, the CLASS program could save Medicaid $2.5 billion in the first 10 years and possibly additional savings after that. And I should note that the Senate Help Committee's version of this proposal was unanimously agreed to in part because of an amendment that was included from Senator Gregg to ensure that premiums are based on the program's 75-year actuarial analysis of the program costs. And Gregg explained his support of the program based on this change alone, basically. Now, the amendment I'm offering includes safeguards like the one Senator Gregg designed. I think it actually gives the Secretary even more flexibility than the Gregg amendment by allowing her some flexibility in adjusting premiums and benefits. And finally, Mr. Chairman, the program we're establishing would not take effect until a subsequent law was passed establishing a voluntary payroll deduction. That means this program can't even begin until we have a mechanism to collect private dollars to finance the program. And this further indicates, I think, that the program is designed to run independent of any federal dollars. I'd ask for support for this. I know it's many people, many of our constituents are concerned about the lack of long-term care in the bill. This is something that addresses some of those concerns and doesn't cost the federal government anything. I yield back.
Gentleman yields back his time. Mr. Barton.
Mr. Chairman, I have some questions for the author or the council. You talk about a voluntary payroll deduction. How does one have a voluntary payroll deduction? That would seem to be mandatory if it's a pay.
No, it's not. I mean, basically, it's an opt-out is the way it would be set up. But if the
It'd be set up so that it was taken out unless they opted not to?
yeah, that's my understanding. If the council wants to talk about it a little more.
Obviously, that provision is not in this amendment because it's not within our committee's jurisdiction. But the way that the proposal is conceived, as I understand it, is much like you would decide to elect one benefit or another from your employer and have the employer you would choose whether to have the employer withhold a certain amount. In this case, it would be the federal government choosing, you would be opted into the program to provide long-term care benefits of this sort unless you opted out, and then the federal government would no longer withhold funds.
If I could reclaim my time, Mr. Barton,
It's
I just
actually
want
my time, but I'll
if
be
I
happy
could
to yield
just
to you.
stress again, nothing happens with this unless Ways and Means at some point essentially, passes a statute that sets up this, voluntary payroll program. I mean, at this point, we're just suggesting this because the actual, voluntary deduction is not under our jurisdiction.
Does the author have a concept of how large the voluntary deduction or premium would be on a monthly basis? And would it vary depending on the age of the volunteering to participate? Somebody at my age, I'm 59, would my deduction, if I decided to opt in or not opt out, be the same as...
CBO estimated that it would be about $65 a month. But
it's not age-based? I'm trying to look who appears to be the youngest member.
Wouldn't it be based on your age?
Well, I'm giving you, that's an overall, and again, that's just an estimate. But again, I can't stress enough that we're not actually setting this up. We're simply suggesting.
Can I get some illumination from the council? Is this...
Perhaps. I believe that the estimate by the CBO was for a national average, assuming an average distribution. Since we do not have a provision here for withholding, we didn't provide them with specs as to an age range or anything like this. We simply said if we had a benefits program like this. So it is my belief that the CBO 65 is what they would expect, what they would project or assume, would enroll on a range across ages.
What's the impression that the subcommittee chairman and the author of the amendment has from Chairman Rangel or Subcommittee Chairman Stark of the Ways and Means Committee about them moving a statute to affect this provision if it were to
Gentlemen,
come
you,
along? I'll be happy.
this was adopted in the Senate Help Bill, and they're in the same situation as we are. They have to rely on the Senate Finance Committee to actually bring about the funding mechanism for this voluntary tax. I would hope we could talk them into it. It would be a voluntary program, and under the way the Senate drafted it, which is the way we're proposing it here, it would be budget neutral, and that it would be actuarially sound.
This. Well, Mr. Chairman, I'm in a quandary here because I support, and I've talked to you publicly and privately about long-term care, and Congressman Deal and I have some amendments later in the markup on long-term care and some incentives, and so it's definitely something we need to do. It's very difficult to accept something that we really haven't fleshed out, but it's certainly an idea that I support. So, I'm in a quandary on this, to be honest. I yield back. I yield to my friend from Michigan.
Again, to express my great affection for him. If you read the language of the amendment, at the second page, at page 3, you will find that the Secretary is supposed to shall establish a national voluntary insurance program, and then you will find that at page 3, at lines 9, 10, and 11, he must see to it that the program, that the benefits and the adjustments and the premiums are all to be in such balance as to, quote, maintain program solvency, and B, to ensure that the program remains deficit neutral.
Well,
And I want to thank my friend.
reclaiming my time, I'm going to support the amendment without binding anybody on my side to support it, with the understanding that if this moves forward, there will be a hearing on this in this committee, and there will be bipartisan efforts to flesh it out. Do I have that assurance from the chairman?
You certainly have my assurance.
Okay.
It's fine with me. Well, he's the subcommittee
Okay.
chairman.
Thank you, Mr. Chairman.
Ms. Eshu.
Thank you, Mr. Chairman. Just a couple of quick questions of the author. The federal government offers long-term care insurance now, and if we choose to buy it, we can, and that's as federal employees, right? Now, how does this plan differ? Is it another insurance, or is it the same? It's an insurance plan that everyone in the country can opt into if they so wish to? I'm not sure I understand how it would work.
The difference here is that this is a cash benefit, basically, that you'd be paying into it, and you'd actually get money to go out and purchase the community services.
So you have money deducted, and the government saves it for you, and
It's
then
like
when you
an
need it?
It's essentially an insurance
So it's a savings
plan.
account?
Yeah, or an insurance plan.
I see. All right. Thank you. Thank you. I yield back.
Mr. Speaker, or Mr. Chairman?
Seeking recognition?
Mr. Chairman, move to strike the last
The
word.
gentleman from Oregon.
Thank you, Mr. Chairman. I wonder if the council, oops, you just thought you were going to get away from the table. I notice on page 1, line 18, it says, provide individuals who have functional limitations with tools that allow them to do a certain set of things. What's the definition of functional limitations? And where would I find that?
I'm not at all sure that it's defined in the term. This is an amendment to the Public Health Service Act. I'm sorry.
Yeah, thank
This is an amendment to the Public Health Service Act. I'm not at all sure that it's defined in the Public Health Service Act. However, in the Social Security Act, for purposes of Medicaid, there are definitions of activities of daily living, limitations that are for people, for instance, who cannot carry out the daily activities that are necessary to function, for instance, dressing themselves or using toilets or bathing or things like that.
And would that definition apply to this term?
Technically, no, because this is in the Public Health Service Act, but to the best of my knowledge, I don't think the term functional limitations is defined. The Secretary would probably look to other similar laws to try to find a definition, but there is nothing in this amendment or the Public Health Service.
And is there anything in this amendment that directs the Secretary to define functional limitation?
On page 2, lines 17 through 19, the Secretary is directed to set a criteria for participation in the program, and I would assume that that would therefore direct her to define functional limitations, because the criteria for eligibility would be those people with functional limitations.
And then let me ask you another question, because I heard the word payroll deduction, but I don't see it in the amendment, correct?
No, sir. The original proposal as introduced as separate legislation and the proposal adopted by the Senate Help Committee both have approaches toward a payroll deduction, but it's not within this committee's jurisdiction and it is not included in this amendment.
And this may not be fair to ask you this question, but I will. Has there been a hearing on the separate legislation from whence this comes?
I'm sorry, sir, I don't know. I'd have to.
Do we know if there's been a hearing?
No.
So there's been no hearing, okay.
Not an argument.
If I
could just
Mr.
continue for a
Chairman.
second.
We did have not in this Congress.
Yeah.
In the previous.
I appreciate that. That's a little different drill. And so I guess my question would be, if we pass this language into this bill, the payroll deduction piece does not exist, correct? And so Ways and Means has already met and marked up this bill.
Yes, sir.
And did they include, they did not include
No.
anything related to the voluntary payroll deduction fees?
No, sir. And so the effect of adopting this legislation would be to authorize such a program, but not provide the funding, not to have.
So it's only a partial sort of part of the bill. I'm going to yield now to the gentleman, Dr. Burgess from Texas, the remainder of my time.
I thank the gentleman for yielding. This kind of reminds me of a Christmas club back when I was a kid. You put some money away each month. You're not paid any interest on it. There's no insurance on the account, but you have the good faith that by Christmas time it'll be there for you and it will have accumulated some value. Despite what my ranking member says, I'm going to reserve the right to oppose this amendment because one of the biggest unfunded liabilities we have in the Medicaid system is our long-term care obligation to people who are my age and who will be Medicare eligible in 10 or 15 years' time. The fact of the matter is we are really not doing enough to prepare ourselves for that pig coming down the python. And I worry that this type of legislation will give people a false sense of security that they have addressed the problem when in fact they have not. I'm also worried about just as already Mr. Walden's already appropriately pointed out, that there's no numbers filed in the bill. We don't know if it did become a payroll deduction, what amounts are there, whether or not it is age adjusted, what the amount of the payout would be when the time comes, what the parameters for the payout would be. So I've got some serious reservations about us doing this and then patting ourselves on the back and say, well, we've done a good job. There is no one who believes in private long-term care insurance more than I do. I've had it for years. I believe it is the right thing to do. I think it is the correct response of my generation to that generation that is coming after us. I'm afraid that by adopting this amendment, my generation will then say, well, we've done our due, we're now doing a payroll deduction, when in fact we may have solved no problem at all. I thank the gentleman from Oregon for yielding. I'll yield back to him.
Well, the time has expired. Are we ready for a vote?
Mr. Chairman, I have a question.
Mr. Deal.
I'd like to ask Council a question. Council, I would direct your attention to page 2, beginning on line 15. It says that the Secretary shall develop this plan in an actuarially sound manner, and then it goes on to say in the number 1 underneath that participation should not be restricted, should not restrict eligibility based on underwriting. Now, does that mean then that if somebody has well, first of all, does it mean that only those who have elected to have voluntarily withheld funds are eligible for the program?
I would understand page 1, line 14 to say that the program must be a national voluntary insurance program, and consequently, yes, sir.
So you'd have to voluntarily have had withholdings from your paycheck in order to be eligible to participate.
Yes, sir.
But since it is not restricted to be based on underwriting, that would mean then that the amount that an individual has had withheld would not determine their eligibility to participate in the program to the same level of benefits as someone who had participated to a higher amount of financial contribution. Is that correct?
I believe that by page 2, line 21, where the Secretary is to establish benefit levels, that is left up to the Secretary to do. So that it could be as you described, or it could be that the Secretary is empowered. I believe the Secretary is empowered to set differential levels too.
So you could have paid in for only 1 month and still be eligible to participate in the program.
If the Secretary structured the program and the benefit level in that fashion.
Well, he would be ordered to make sure that it is not restricted on eligibility based on underwriting.
Gentlemen, yield to me. You just raised a good point, and I asked Mr. Pallone's counsel, how can you have a program without underwriting? As soon as you need to go to a nursing home, you sign up in the program. And he pointed out to me that there would be a requirement for vesting. You'd have to pay into the program for a certain period of time before you'd be able to get any benefits out of the program.
Well, I appreciate the chairman's explanation. It just doesn't seem to jive with the language that I see here. If you don't restrict eligibility based on underwriting, then I don't see how you make it actuarially sound, or how you make a differentiation between people who've paid in for a long period of time versus those who've only paid into a short period of time. Perhaps
gentleman yield?
perhaps this, as counsel indicates, that the benefit levels under under Section 3 there might be at a different benefit level.
If the gentleman would yield, I mean, that's
Yes.
essentially what we're doing with 2, establishing criteria for eligibility for benefits, which would mean that you'd have to be, paying in for a certain period of time, establish benefit levels, mechanisms. So all these things about how much you pay in, what your functional problems are, all those would determine, whether you receive benefits and when, and how much you paid into it. I mean, that's what these are all meant to establish.
Well, as we all know, one of the things that insurance programs, and this is basically an insurance program, is to try to avoid adverse selection. And it seems to me that this is wide open for adverse selection to take place and, in effect, make the entire program not financially solvent. I support the concept, quite frankly. I'm like the ranking member. I think I would like to see us have programs of this type. I have serious doubts about the language being adequate to address the problem that we're trying to solve.
Well, if the gentleman would yield, I mean, let me say, we adopted the language that's on page 3 specifically to deal with that. And again, this goes back to the Gregg Amendment in the Senate, where, we're saying that, that the Secretary would make adjustments to benefits paid out and premiums collected in order to maintain program solvency, ensure the program remains deficit neutral. That language is specifically put in there to make sure that happens over the life of the program. That's why we have that language.
I understand that part. I'm just not sure it reconciles with the earlier part, but I yield back. Thank you.
I move to strike last word.
Mr. Blunt?
Thank you, Mr. Chairman. I want to go back to Dr. Burgess's point, which I'm more concerned about now than I was when he made it, as I heard the explanation here. I'd ask the author, how would you know what the benefit of this plan was when you signed up for it?
Well, we're not, again, as I say, we're not specifying that now. We're asking that the Secretary would develop that. I mean, that's got to be done by regulation and by the Secretary's action. But when you sign up, you would know because the regulations would specify.
Would be, and is there anything here that would protect you in having to spend down so that you wouldn't go from Medicare to Medicaid or any of the other incentives that seem to me to make more sense in encouraging moving into long-term care?
I mean, the whole purpose, I don't know if this answers your question, but the whole purpose of this is basically to have some kind of cash payment that you could use to buy services, and it essentially avoids the problem that you have with Medicaid now, where you have to spend down. And that's why the CBO said there's significant savings in Medicaid to the point of $2.5 billion, because people would have the money to pay for these services. They wouldn't have to spend down the way we do now under the existing Medicaid program.
Well, reclaim my time unless Dr. Burgess is right, and all this does is convince you that you've got a benefit you really don't have. I know there's one estimate out there from some group that maybe this would be no more than 12%, and they're likely, I think this is from the American Council of Life Insurance or something we all got today. I'd like the ranking member and our subcommittee ranking member, Mr. Deal, I'd like to see us do something on long-term care, but I think there are things that would be create more incentives to encourage the states to work with us so that you didn't have to do the Medicare spend down totally to get into Medicaid if you had planned appropriately, and I don't see any of that here, and I'll oppose this amendment, but I will.
If the gentleman would yield.
Yes, I would yield.
Yeah, I mean, I'm trying to make it clear that, this is not, you understand, it's not paying for nursing home care. It's paying for, services that you would buy to keep you at home, essentially.
It couldn't pay for nursing home care?
No. The whole idea here is to prevent institutionalization. People don't have to go to nursing home, don't have to go to hospital. They stay home. They live independently. That's why, the cost is not as high as you might imagine, because it's not paying for that institutional care. And I mean, I listened to what Dr. Burgess said, and I appreciate the fact that you don't want people to have high expectations that, we're doing something that we're not. But I also think that since we're really not doing anything else, something like this, which is a voluntary program and does encourage people to be able to stay at home and provide benefits so that they can, I mean, it would be real in that sense, and it would achieve not only savings in Medicaid because people wouldn't have to be institutionalized, but also a better quality of life.
Well, would the gentleman yield?
I would.
I thank the gentleman. I thank
Yes,
the gentleman
I
from Missouri. I wanted to ask the author a question. Ms. Pallone, do you envision then that this withhold, you say it's on a voluntary basis, but would have to be an opt-out, do you envision that this money would be invested in an individual personal account, or do you think that this money would be invested in, say, like the Medicare Trust Fund that's currently probably earning 25 basis points or 1/4%
It
return?
is a trust.
How do you envision?
It's a trust account, not individual.
It would be in
Right.
a trust account, earning current rates, which are probably less than 1%. So you don't envision this money, an individual being able to say, I want my withhold to be invested, maybe a small percentage of my withhold to be invested in an individual personal account with a far greater
I mean, the
rate of
idea
return?
would be at a trust fund, and people would only be able to take advantage of the program if they had functional limitations, if they had chronic illness, if they were unable to, take care of themselves, essentially needed care.
And the gentleman suggests this would cost maybe $65 a month, hoping you wouldn't have to go to a nursing home for...
Well, that's not my estimate, that's CBO's. But again, if you think about it, when you talk about community services, services that avoid institutionalization, they are a lot cheaper than, a hospital or a nursing home.
Up here.
Gentleman's
Yeah,
time has
Mr.
expired. Mr. Dingle.
The requisite number of words.
Gentleman's recognized.
There's a great axiom in the gunsmithing trade: when all else fails, read the instructions. And I think here what I ought to do is to read some of the language that we've got. It's been reported it's going to be $65 a month in premiums. Now, the purpose of this program says the Secretary shall establish a national voluntary insurance program to be known as the Class Independence Benefit Plan for purchasing community living assistance services and reports. That's at the first page, lines 13 through 16. Then it says, such program shall provide individuals who have functional limitations with tools that will allow them to maintain their personal and financial independence, to live in a community through a new financing strategy for community living assistance and supports. And then the Secretary is instructed to establish an infrastructure that will help the nation's community living assistance service and supports needs. And then there's some other chores that he has given, but doesn't change the basic purposes set forth. Then it says, the Secretary shall develop the Class Independence Benefit Plan in an actuarial sound manner and set criteria for participation in the Class Independence Plan that do not restrict eligibility based on underwriting. He shall establish the criteria for eligibility for benefits, establish benefits levels, establish mechanisms for collecting and distributing payments, and provide the mechanisms to assist beneficiaries in the use of the benefits. Now, I'm reading from the language of the amendment. Then he's directed to promulgate such regulations as are necessary to carry out the class program in accordance with this title. And then then under 7, to take any other action appropriate to develop, manage, and maintain the Class Independence Benefit Program, including making adjustments to benefits paid out and premiums collected in order to, and then this is the language I read earlier, maintain program solvency, and ensure the program remains deficit neutral. And then he's required to report. There's nothing here to frighten anybody. I'm just reading you, my dear friends and colleagues, the language of the amendment, which should be a great source of comfort. It's voluntary. They don't have to do it. It's got to be actuarially sound, and the Secretary has given clear instructions as to how he's to administer it, to keep it actuarially sound and deficit neutral.
Would the gentleman yield?
I'll be happy to yield.
On that point number 7, that's what concerns me the most, my friend, that you include making adjustments to a benefit paid out and premiums collected in. You could start into this program and not know what benefit you were going to get or what premium you were going to pay as you got into it, because the Secretary would consistently be able to adjust it to keep it actuarially sound. It just seems to me it's a big step to take without any at 20 till 12 at night without having the hearing on it. And I think it is not comforting. I think it's actually just the opposite, not to know what those adjustments would be when you decide you want to enter into the program. But I yield back.
Reclaiming my time and with great affection for the gentleman, I read the language the gentleman refers to earlier, but the Secretary is instructed to do certain things, including establishing the program and criteria for eligibility, benefits, establish benefit levels, and do a bunch of other things to create the plan. And in doing so, he is instructed to maintain program solvency, ensure the program remains deficit neutral, and in order to do that, under 7, he's instructed to make adjustments to benefits paid out and premiums collected in order to assure program solvency and that the program remains deficit neutral. What we're trying to do is to set up something that's not going to cost the taxpaying public anything, but rather to see to it that we have a program that takes care of the particular concern. Now, there's 2 other points that are important here. First of all, it has been said that it will save, and this is the Congressional Budget Office, it'll save about $2 billion to Medicaid. And second of all, they have pointed out that this program here will be voluntary and will enable the people here to begin to finally live on their own and to get around the drawdown that has been a matter of concern to my colleagues on the committee.
Gentleman's time has expired. How many members wish to speak on this proposal? 1, 2, 3, 4. Would you be willing each to take 2 minutes each?
I will. I'll agree to that.
Okay, 2 minutes to each of you. Mr. Stearns first.
Well, I would say to the, strike the last word, requisite number of words. I would say to the gentleman from Michigan, tell me what federal government program is actuarially sound. Tell me one in this country. You know, Medicare, Medicaid, Social Security. I mean, all of those are not actuarially sound, and you keep saying that this is going to be. Now, the gentleman from Michigan mentions all the cost savings to Medicare. How can you possibly talk about cost savings when you don't know what the premiums are, you don't know what the benefits are, you don't even know anything about the payroll? And in fact, this is a tax because you've got to opt out. And
With
so
the gentleman,
average Joe sits there and he doesn't know that he's being taxed.
Will the gentleman yield?
No, I'm just saying here, you've got something that is a sort of amorphous type of bill that's really not in our jurisdiction, and you're asking us to swallow this thing here when you're saying it's going to be actuarially sound. We have no proof that anywhere in the government are they actuarially sound, and there's no benefits that are outlined. So we don't know anything that Mr. Dingle indicates that's true benefit to Medicare or Medicaid, anybody. And lastly, I tell my colleagues, you don't want to force a person to go into a program, and it's just basically a mandatory. You're in the program, you've got to have the will and wherewithal to get opt-out, and you don't even know what kind of benefits you're getting. So I think it's a bad bill.
Gentleman yielding back his time. Who is next? Mr. Shimkus.
Thank you, Mr. Chairman. Danny Davis and I have dropped a bill for many years now called MICASA. It's changed its name. But the basic premise was Medicaid disability money follows the individual. And the premise is the same thing as the premise of this, is if we had to keep people in their home, they wouldn't be in institutional care. And you use that Medicaid dollars to help offset the attendant care, we're all winners. And I think that's a better option. And that's really a freedom option instead of forcing people into institutional care. Now Senator Harkin had the bill on the Senate side, and I think that is a respectful way to help people really determine their own lives. And I wish we would look at that versus this. I would rather incentivize the private sector through a tax incentive and payroll deduction, and like deferred compensation plan, where you get the tax benefit and then you incentivize the private sector. Because I again also, I have the same type of problems. I think the money is going to go like everywhere else we go. It's going to go to the U.S. Treasury, and it's going to offset our it's going to be income generated until we have to pay it out, and it's going to be like the Nuclear Waste Fund or the Social Security Trust Fund. There's no trust funds. The Highway Trust Fund, you name it, that's where this is going to go, and that's why I'll vote no. But if we would like to work on Medicaid dollars following the individual and not incentivizing institutional care and freeing up the disabled to choose the areas where they want to live and how they want to live, I'm willing to work with you. I yield back my time.
Gentleman yields back his time. Who is next? Mr.
Chairman?
Boyer.
Well, I have the CBO letter in my hand, and I'm surprised no one's even talking about the CBO letter. CBO has expressed some pretty strong concerns about what you're proposing, Mr. Pallone. And I guess when you look at your legislation, I have to ask this question. In the CBO letter, they talk about the average premium would be limited to $65 per month in 2011 and indexed for inflation. I don't know where they're getting these numbers and how they're setting this up. I mean, when you give us this amendment, we don't know, but you must already know and assume of some type of a program because CBO scored it. And so even when the chairman had a question, the chairman was even unaware that you had a 5-year vesting time period. So if there's a moment here that we, as chairman, we shouldn't be marking this bill up, this amendment to this bill. This is one whereby I would ask the chairman that you withdraw this. We have a separate hearing on this and move this separately for legislation. And let us work in a bipartisan fashion with regard to this specific legislation. CBO has expressed great concerns with regard to the solvency. And if we're talking about a $50 benefit, a non-Medicare certified home health aide charges $19 an hour. That's 2.5 hours of labor. I mean, we're not talking about a huge benefit here. And if we're talking about charging $65 per person for a $50 benefit, we've got some issues we need to work through. And so I would ask Chairman Pallone, withdraw this, and let's move this as a standalone bill and work with both sides. And that would be my request and I yield to the chairman.
Would the gentleman yield?
Yes.
The CBO letter you're reading, we essentially responded to that by adopting, as I said, the Gregg language or something similar to the Gregg language. In other words, what they say is that it's a problem if the Secretary did not modify the program to ensure its actuarial soundness. So that's why we have that language that does, in fact, ensure the actuarial soundness and allows the Secretary to go in and make those changes. And that's exactly what was adopted in the HELP bill in the Senate.
Reclaim my time.
In order to address that concern.
Senator Gregg recognized this problem. He offered an amendment that was accepted that would require the Secretary of HHS to establish a premium rate prior to enrolling folks in the program that would ensure solvency for a 75-year period.
And that's why we have that language on page 3 that we've mentioned many times that says the Secretary can take action to make adjustments to benefits paid out and premiums collected in order to maintain program solvency and ensure the program remains deficit neutral. That's exactly what the CBO suggested in order to address the problem.
Has expired. Mr. Terry.
Mr. Chairman.
Thank you, Mr. Chairman.
May I be included in those that wish to speak after Mr. Terry?
Okay, 2 minutes. Mr. Terry.
Thank you, Mr. Chairman. I want to commend Mr. Pallone for identifying an area that I think is sometimes skipped over, but significant in the continuum of health care, and it's that period of time where people are teetering between being able to stay home and having to go to a facility, a skilled nursing or facility, or even maybe the hospital. And I believe that your focus is in the right place. I'm just curious, because here's how I see it. If you remember back to my opening statement, I talked about how part of the pay-fors for this plan is creating, quote, savings, which providers view as cuts, and we're taking a $57 billion savings to home health care. And we're replacing that piece of home health care where people go to your home and help you to stay in your home so you're not institutionalized, and now replacing that with a opt-out pay-for program. If Republicans offered cutting home health care and Medicare benefits and then replacing them with something that people had to pay for to receive again, I'm sorry, but you guys would have gone ballistic on that side of the aisle. And so now it's our turn to go ballistic in the sense that, yes, this is necessary to keep people in. It is more humane to the people who want to stay in their homes, and an incredible cost savings to us that they aren't going into an institution. But it strikes me as odd that at the same time we're trying to create this program here, that we're cutting $57 billion of home health care. I yield back.
Gentleman yields back his time. To close the debate, Mr. Radonovich.
Thank you very much, Mr. Chairman. I applaud the efforts on behalf of yourself, Mr. Pallone, in tackling a tough problem. I do have a question of counsel, a quick question. Counsel, on page 3, lines 7 through 11, it talks about the premiums collected in order to maintain program solvency and ensure the program remains deficit neutral. In a fund generated by a proposal such as this, is there any chance that it could be IOU'd like the Social Security Trust Fund?
I'm sorry, sir, I don't understand the question.
This would create a fund, and is there any chance that that fund would be IOU'd like the Social Security Trust Fund has been over the years?
Do you mean the essential purchase of Treasury bills with Social Security funds?
Meaning that the account is IOU'd and spent for something other thing? Yes.
I think we're saying the same thing.
Yes.
It's, as I understand it, there's a general rule in the Ways and Means Committee that all trust funds held by the federal government are to be invested in. They're not technically Treasury bills. I think they're called Treasury warrants. But I believe that they are all, regardless of what the fund is about, they are all invested in Treasury warrants.
So it could go into the general Treasury and be a debt later on?
The Treasury warrant has a face value, so technically the holding of the fund is still valuable. I'm trying not to say that the money is
Say the word
gone.
debt.
It is as if it had been invested in a Treasury bill, and that the fund held a Treasury bill during that time, which is redeemable at full faith and credit of the United States.
Much like the Social Security Trust Fund.
Yes, sir, exactly like the Social Security Trust
Fund.
Fund.
And I think you're tackling a problem that needs to be tackled. Because of the problem we have in Social Security right now, you know, we're very easily could do the same thing, and that's why I don't support it. I'll yield back.
We're now going to proceed to a vote. Mr. Barton asked for 30 seconds.
Yeah, Mr. Chairman, 40 years ago, at 11:56, equivalent to our time today on daylight savings time, Neil Armstrong became the first person to land on the moon. It's almost 40 years ago to this minute, if that clock is correct. And anybody over 40 years old in this room probably remembers exactly where you were. I was not in the hearing room on the healthcare markup, I can assure you. But that was a great occasion for all of mankind, and my hat's off to NASA and Neil Armstrong and all the heroes of that era.
We on the West Coast thought it was 8:56.
7:56.
7:56. We now proceed to a vote. All those in favor of the amendment will say aye. Aye. Opposed, no. In the opinion of the chair, the ayes have it. Now we have another amendment on this side, or can we proceed to amendments on our side?
There's a Gingrey.
Mr. Gingrey, you have an amendment.
Mr. Chairman, I do have an amendment at the desk. It's Gingrey 13002.
Clerk will report the amendment.
Amendment offered by Mr.
gonna try to do
Gingrey
them.
in Section 931B of the Public Health Service Act, as added by Section
Without objection, the
2401.
amendment will be considered as read. The gentleman is recognized to speak on his amendment.
Mr. Chairman, I thank you. Early in the evening, I had an amendment that the majority side turned down on pretty much strictly a party line vote. And that, of course, was to not allow the Centers for Quality Improvement to dictate to physicians to take away essentially the art of the practice of medicine. Mr. Chairman, this amendment, I think, may be even more important, and I would refer
Mr. Gingrey, would you yield to me?
Yes, Mr.
We're
Chairman.
prepared to accept your amendment if you don't talk on it.
Well, let me.
I would take that
Let
deal.
me just. Let me. Yeah. Let me just say this. Give me.
Vote.
I'll try to limit.
Vote.
All right, Mr. Chairman, I hear a lot of votes on this side of the aisle, so I graciously accept your acceptance of this amendment. I think it's absolutely essential that we don't ration care to our seniors. And let's vote. Vote.
All those in favor of the Gingrey amendment say aye.
Aye.
Opposed, no. The ayes have it. The amendment's agreed to. Now, we have a few more amendments, but I'd like to ask unanimous consent that we limit the debate to 5 minutes for the amendment, 5 minutes against the amendment, although not all the amendments are going to be opposed. What do we have? Mr. Doyle.
Thank you, Mr. Chairman.
You have an amendment at the desk.
Yes, I have
Clerk will
amendments at
report
the desk. It's Doyle number 1, McNerney number 2, and Engel 4-003. Mr. Chairman, I'd like to ask unanimous consent that these amendments be considered en bloc.
Without objection, that'll be
Reserving the right.
Reserving the right to
Reserving
object.
the right. I just want to make sure that these are the amendments that we've agreed to that are in block. Is that correct?
Yeah, I think so.
We think so.
We think they are, but we'll just wait and pass them on.
If they're not, we'll...
Could we have the titles of the amendments in block?
Yes, let's have the clerk report the titles of the amendment before we put the unanimous consent request to consider them in block.
A Doyle amendment to subtitle Grants for National Training.
We're okay on that one.
Without objection, that one will be considered as read.
Amendment by Mr. McNerney and Ms. DeGette of Colorado at the end of Section 2401.
We're okay on that one.
Okay.
Without objection,
And-
that'll be considered as read.
And then an amendment in the nature of, to the amendment in the nature of substitute by Mr. Engel of New York,
We're okay on that one.
That's
page
it.
9.
Without objection, that amendment will be considered as read. Let me put the unanimous consent that without objection, these three amendments be considered as block, in block. Without objection, that'll be the order. Mr. Doyle?
Thank you, Mr. Chairman. Mr. Chairman, I also request unanimous consent to add my colleague, Mr. Engel, as a co-sponsor of Doyle number 1 also.
Without objection, that'll be the order.
Mr. Chairman, I offer this amendment with my friend and colleague Elliot Engel, who has worked with me on this provision in our bill, the Autism Treatment Acceleration Act, which was also introduced with my co-chairman of the Coalition on Autism Research and Education, Chris Smith from New Jersey. We introduced this language because there's a critical shortage of appropriately trained personnel across numerous important disciplines who can assess, diagnose, treat, and support children and adults with autism spectrum disorders and related developmental disabilities and their families. Mr. Chairman, I'm glad to know that you've pledged to work with me on my top priority, making sure that this bill ends autism insurance discrimination. But because this division of the bill addresses 21st century healthcare workforce issues, I want to make sure that we're translating current and future research results into effective practices. We need to support children and adults with autism spectrum disorders and related developmental disabilities with early intervention and preschool programs, child care, community schools, health providers, employment sites, community living, and first responders. This amendment creates a national training initiative on autism and a technical assistance center to develop and expand interdisciplinary training and continuing education on autism spectrum disorders. I hope that everyone will support this amendment, and I'd like to yield to Mr. Engel.
Well, I thank my colleague for yielding for me. I've had the privilege of working with Mr. Doyle, who's co-chair of the Congressional Autism Caucus on comprehensive autism legislation for several years. And we know, of course, with the growing number of people diagnosed with autism, many of whom are aging out of the school system, it's imperative.
Mr. Chairman, if they keep talking, we're going to withdraw our support for these amendments. We didn't let Mr. Gingrey speak on his, so we shouldn't have to hear ad infinitum the great things about these, although they are great amendments, which is why we're supporting them.
All right, I'll put it in the record then, as long as Mr. Barton supports the bill.
I support it in its current form, as long as we don't talk it to death.
Are we ready for the, are we ready for the vote? All those in favor of the amendments in block say aye. Aye. Opposed, no. The ayes have it, and the amendments are agreed to.
Okay, that's the quickest three.
Mr. Matheson, you have an amendment you wish to offer and withdraw. For that, we give you only 2 minutes.
Mr. Chairman, I'll just offer to put my full statement in the record if I can. But I'd just like to call up my amendment number, Matheson 1002. It's a bipartisan amendment with my colleagues, Mr. Rogers from Michigan, Ms. Escher from California, and my colleague, Ms. Sutton from Ohio.
Without objection, the amendment will be considered as read, and without objection, the gentleman's full statement will be in the record.
Thank you. Very briefly, I just want to say that while there are many geographic shortages across the country in general pediatrics, data also shows that there are pronounced shortages across the country in some pediatric subspecialties and pediatric surgical specialties. I know that when we start talking about specialties and subspecialties, Mr. Chairman, this could open up a number of different challenges. I would just point out that in terms of pediatrics, this is an issue where there's some specific problems around the country. I know that it creates some challenges. That's why at this time I will agree to offer and then withdraw the amendment. But I hope, Mr. Chairman, that you could be willing to work with me. I don't know if there are any of my colleagues who want to say something on this amendment. But
I certainly want to work with you and your colleagues on this amendment.
Can I just yield to Mr. Rogers some time just to, because he
And I won't say, I just want to commend the gentleman and Ms. Escher for working together on this. It's very, very important, and I think it represents the best of the work here in the committee. Thanks.
No. Mr. Chairman?
I'll yield to Mr. Burgess.
I appreciate the gentleman bringing this up. It's terribly important. I just want to make the point, and it cannot be made often enough, that unless we do something about our nation's medical justice system, about our liability laws, pediatric surgeons will continue to have liability 2 years from the date of discovery, and the date of discovery cannot begin until age 18 in most state jurisdictions. So that is an incredibly long period of time that the statute of limitations runs for these surgeons who do very risky operations, oftentimes on very, very sick small patients. So I think it is imperative that if we do this, we also need to obligate ourselves and dedicate ourselves to fixing the problems we have in our medical justice system, perhaps even just for the subspecialty or the specialties of pediatric surgery or these very high-risk specialties. But if we don't do something about the liability climate, we're never going to solve the manpower issue. And I thank the gentleman for bringing it up.
Thank you. Could I also yield to Ms. Escher?
I want to thank Mr. Matheson, Mr. Rogers, and Mr. Chairman. Thank you for your commitment in working with us in the area of rheumatoid arthritis. When it comes to children, there are 11 states that don't even have one rheumatoid arthritis specialist. And this is devastating for children. If they go undiagnosed, their adulthood is essentially a body that looks like a pretzel. So we have a lot of work to do on this. I appreciate your willingness to work with us, and I thank the gentleman for yielding to me.
With that, I'll yield back, Mr. Chairman.
Thank you, Mr. Matheson. You withdraw your amendment,
Yes.
and we'll continue to work on it. Mr. Space?
Thank you, Mr. Chairman. I have an amendment at the desk.
Without objection, the amendment will be considered as read. The gentleman is recognized for 2 minutes.
Thank you, Mr. Chairman. I'm offering this amendment with the intent to withdraw. The amendment is being offered because of concerns that the provision in this legislation creating a medical device registry may be unnecessary. While I join all of my colleagues on both sides of the aisle in supporting ways to reduce costs and enhance quality of health care, I fear this new registry will not accomplish the desired goal. In particular, I worry that many of the duties of the registry would be redundant with responsibilities of the FDA. The FDA is already implementing its Sentinel initiative that will allow the agency to pull data from existing registries to help understand medical device performance and patient safety issues. In light of those potential redundancies, creating a large new registry may therefore not be productive. A comparable registry implemented by the American Academy of Orthopedic Surgeons yielded a net cost of $25 million per year. Again, Mr. Chairman, because this provision is a new one, I believe that further discussion is merited before we sign it into law. Given your indication to work with us on this issue, I offer my...
The gentleman yield.
Of course.
In Indiana, we have many medical device manufacturers, and if you're going to work with the chairman, I would like to be included in that.
By all means,
I yield back.
And would the gentleman
Would the
yield?
gentleman yield?
Yes.
Yes. Thank you to my colleague. I don't think it's my understanding that first of all, the gentleman raises, I think, some very important points, and I'd like to add one to them. And I don't believe that the FDA has been consulted on this issue. I think the FDA needs to be brought into it. As I understand the amendment, it would. Well, I think it's extraordinarily complicated, and we need to ferret through this very carefully. It's an important area, so I thank you for yielding to me, and I look forward to being part of the team that will work on this. Thank you.
In space, I'll look forward to working with you and all of our colleagues that have an interest in this very issue. Do we need more discussion?
No, I want to weigh in for about 30 seconds, Mr. Chairman.
Go ahead.
Just to say, the FDA is already doing a Sentinel initiative. CMS already doing some stuff. Agency on Healthcare Research Quality is doing stuff. The American Academy of Orthopedic Surgeons are already doing stuff. So I think you'll find a lot of support against duplication unnecessarily. So I'd like to join my colleague, Mr. Space, in this amendment also.
Thank you very much. Mr. Space, you withdraw your amendment?
I do, Mr. Chairman. Thank you.
We now go to the Republican side. Is there an amendment on the Republican side? Joe? Mr. Burgess?
Well, Mr. Chairman, I would like to be recognized for the purposes of asking the chairman to engage in a colloquy.
Gentleman's recognized.
Well, thank you, Mr. Chairman. And as you well know, and we've had this discussion before, the work that's gone on in this committee trying to ensure having a future physician workforce to care for America's patients. Mr. Green and I passed H.R. 914 out of this committee earlier this year. And in fact, last year we got it passed on the floor of the House only to die in the Senate. My intention is to offer this bill as an amendment. The underlying bill makes good investments in the country's physician workforce. It's my understanding that, or at least I've been told that the committee is willing to work with me to further this important aspect of the broader health care reform, and that our staffs can continue to work to find ways to ensure that this provision can be modified to become part of the existing package. And I would just simply ask if I'm correct in assuming that I have the chairman's commitment on that.
If the gentleman would yield, yes, you are. You are accurate. I want to thank the gentleman for this idea. Providing more incentives to start residency programs is an idea we took very seriously when designing our workforce program. Some of this policy is very similar to sections of the America's Affordable Health Choices Act. Section 2214 of our bill directs grants for the purposes of initiating a new primary care residency program in outpatient centers and for supporting such programs. I think there's some good ideas here, and I want to see if we can work together on them and see if we can put them in the legislation.
I thank the chairman.
Mr. Terry, are we, who else is waiting? Anybody else waiting? Mr. Terry,
I have an amendment at the desk. Is it an appropriate time, or are we just going through colloquies right now and I can?
well, is this an amendment to this title?
Yes.
Yes.
Okay.
The clerk will report the amendment.
It's one that starts at the end of Section 3111 of the Public Health Service Act as being added by Section 2301A of the bill.
Without objection, the amendment is considered as read. Gentleman is recognized for 5 minutes to explain. Can you do it in?
Sure.
What do you want it, 2?
Give me 2 minutes, but I want to start off.
Oh, it's going to be opposed.
Pardon me? Yes.
Okay.
Then I need 5 because I need to start off.
Gentleman's
with
recognized for
unanimous
5
consent.
minutes.
Thank you. I want to start off by asking for a unanimous consent to amend this to 1 trillion as opposed to the 100 billion or less currently in the amendment. Thank you.
Well,
Hearing no objections, so ordered.
What is your bill? What is your amendment?
I think you just accepted it.
No, we didn't. He asked unanimous consent.
So
He
we
said,
didn't hear an
"Thank you."
objection.
Well, the chair hasn't quite put the unanimous consent request. You want to put in this amendment?
He wants to strike 100
Yeah,
billion.
in line 6, instead of 100 billion or less, just 1 trillion or
Well, it's your
less.
amendment. Without objection, that'll be the order.
Thank you. This amendment is an effort to stop wasteful spending by the federal government. The amendment would prohibit new prevention and wellness trusts from going into effect unless the projected federal deficit for the next fiscal year is 1 trillion or less. Section 2301 of the chairman's bill authorizes $35.3 billion for new prevention and wellness trust, which will be used to fund public health and workforce activities in the bill. This includes grants to states and local public health departments for providing community wellness services. This can mean anything from what we've heard on various news reports and newspaper articles, from installing more jungle gyms to creating bike trails and parks, inherently municipal responsibilities for recreation. Just this week, it was reported that our federal budget deficit had already topped $1 trillion for the year and was on pace to grow to nearly $2 trillion by the fall. The chairman's bill will add billions in new spending. This amendment would help stop this wasteful spending. According to the Congressional Budget Offices and Joint Committee on Taxation Assessment, enacting the chairman's bill would result in a net increase in the federal deficit of $239 billion over 2010 to 2019 period. Even President Obama has promised that the health care reform must be and will be deficit neutral in the next decade. This amendment will help President Obama promise to keep his promise to the American people. This Prevention and Wellness Trust is just part of the massive new public health investment fund. The fund is authorized at $88.7 billion and is outside of any budgetary requirements. So at this time,
Would the gentleman yield?
I would yield to the ranking member of the committee.
Yeah, this is pretty straightforward. What we're saying here, all the folks that are trying to be fiscally conservative and that believe in pay-go, that we're not going to let this section go into effect unless we get the annual budget deficit for the whole federal government down below $1 trillion a year. It's currently $1.6 trillion. Now, President Obama's budget and the Republican budget that was put on the floor, the President Obama's budget did get below $1 trillion, and the Republican budget got well below $1 trillion. So this is a target that is defensible. It's still a huge budget deficit. I mean, $1 trillion is nothing to laugh about, obviously, but at least it would give us a start to being fiscally responsible. It's that straightforward, that we want to work together to get the deficit below, on an annual basis, $1 trillion per year before it goes into effect. That's all it is.
The chair recognizes himself. In opposition.
I'll yield my remaining time to you.
Thank you. In opposition to the amendment, we need to reduce the deficit and work toward a balanced budget. That's why we produce a bill that CBO confirms is deficit neutral over 10 years. That's why the bill contains the largest reductions in spending for Medicare and Medicaid ever proposed, and that's why the House has endorsed pay-as-you-go rules. But the dollars we spend on prevention will be the most efficient and cost-effective investments we make in health reform, and it makes no sense to hold prevention hostage to the broader debate over the budget. This amendment would say that all the work and all the cutting-edge ideas that we've already agreed to provide prevention research and deliver innovations to try to prevent diseases would no longer be in effect. So I would oppose this amendment, and I urge my colleagues to oppose it. We'll now proceed to a vote. All those in favor of the Terry amendment will say aye. Aye. All those opposed will say no. No.
Mr. Chairman, we ask for a roll call vote.
We'll go to roll call vote. Let me announce before we take the vote, this is the last vote of the evening. We will not meet tomorrow because we have discussions ongoing with members. I think we're making good progress, and I want to pursue those discussions further. So this will be the last vote. No
Parliamentary inquiry,
tomorrow.
Mr. Chairman.
And we will meet on Wednesday at the call of the chair.
Parliamentary inquiry, Mr. Chairman.
Yes.
I have an amendment at the desk that's been there 2 hours and 54 minutes. And I did submit it yesterday.
Okay. We're in the middle of a roll call, and then we'll talk about your amendment. Clerk will call the roll.
Mr. Waxman?
No.
Mr. Waxman, no. Mr. Dingle? Mr. Dingle, no. Mr. Markey? Mr. Boucher? Mr. Pallone? Mr. Pallone votes no. Mr. Gordon? Mr. Rush? Ms. Eshoo? Ms. Eshoo votes no. Mr. Stupak? Mr. Stupak, no. Mr. Engel? Mr. Engel, no. Mr. Green? Mr. Green, no. Ms. DeGette? Ms. DeGette, no. Mrs. Capps? Mrs. Capps, no. Mr. Doyle? Mr. Doyle, no. Ms. Harmon? Oh, Ms. Harmon, no. Ms. Schakowsky? Ms. Schakowsky, no. Mr. Gonzalez? Mr. Gonzalez, no. Mr. Inslee? Mr. Inslee, no. Ms. Baldwin? Ms. Baldwin, no. Mr. Ross? Mr. Ross, no. Mr. Weiner? Mr. Weiner, no. Mr. Matheson? Mr. Matheson, no. Mr. Butterfield? Mr. Butterfield, no. Mr. Melanson? Mr. Melanson, no. Mr. Barrow? Mr. Barrow votes no. Mr. Hill? Ms. Matsui? Ms. Matsui, no. Mrs. Christensen? Mrs. Christensen, no. Mr. Sarbanes? I'm sorry, Ms. Castor. Apologize. Ms. Castor votes no. Mr. Sarbanes? Mr. Sarbanes, no. Mr. Murphy of Connecticut? Mr. Murphy, no. Mr. Space? Mr. Space, no. Mr. McNerney? Mr. McNerney, no. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley, no. Mr. Welch? Mr. Welch votes no. Mr. Barton? Mr. Barton, aye. Mr. Hall? Mr. Hall, aye. Mr. Upton? Mr. Upton, aye. Mr. Stearns? Mr. Stearns votes aye. Mr. Deal? Mr. Deal, aye. Mr. Whitfield? Mr. Whitfield, aye. Mr. Shimkus? Mr. Shimkus, aye. Mr. Shattuck? Mr. Shattuck, aye. Mr. Blunt? Mr. Blunt, aye. Mr. Boyer? Mr. Boyer, aye. Mr. Radonovich? Mr. Radonovich, aye. Mr. Pitts? Mr. Pitts, aye. Ms. Bono-Mack? Ms. Bono-Mack, aye. Mr. Walden? Mr. Walden, aye. Mr. Terry? Mr. Terry, aye. Mr. Rogers? Mr. Rogers, aye. Mrs. Myrick? Mrs. Myrick, aye. Mr. Sullivan? Mr. Sullivan, aye. Mr. Murphy of Pennsylvania? Mr. Murphy, aye. Mr. Burgess? Mr. Burgess, aye. Ms. Blackburn? Ms. Blackburn, aye. Mr. Gingrey? Mr. Gingrey, aye. Mr. Scalise? Mr. Scalise, aye. Okay.
Any other members wish to be recorded?
Mr. Markey? Mr. Markey votes no. Mr. Boucher? Ms. Boucher votes no. Mr. Boucher votes no.
Any other members wish to be recorded? If not, the clerk will tally the vote and announce it.
On that vote, Mr. Chairman, the ayes were 23, the nays were 33.
Ayes 23, noes 33. The amendment's not agreed to. Mr. Rogers, you have an amendment. Other members on our side have amendments to this title. No one will be precluded from offering these amendments. We'll either come back at the next markup and go forward with those amendments to this title, or we will recognize them later in the markup. But
As long as they won't be precluded, Mr.
You will not
Chairman,
be
I find that
precluded.
acceptable.
And but I made a promise that we'd be out of here by 12, and I want to keep that promise.
So in California, you're keeping it, but in Washington, you're not.
So we stand in recess to the call of the chair.